City Commission to order. We have Commissioner Simmons, Johnson, Sacco, Hayes Santos, and myself present. Chair Hutchinson, if you would like to call your board order.
Yeah, the Board of County Commissioners, I see Ken Cornell, Mike Byerly, myself, and I know Chuck Chestnut has another meeting that will be ending in about a half hour, 45 minutes, and he'll be here. And I don't see Commissioner Wheeler. Okay. So there's three of us right now.
Move approval of the agenda, Hutch.
Got a motion and a second to approve the agenda. All in favor signify with aye.
Aye.
Aye. That motion passes 3-0.
Okay, City Commissioners, I need a likewise motion to approve our agenda.
Move to approve our agenda.
All right, got a move from Hayes Santos, second from Johnson. All in favor, say aye. Aye.
Aye.
Aye.
All opposed, like sign. Seeing none, that motion passes unanimously. Welcome, Commissioner Ward. Very well, we will go right into it. I want to welcome our guests from the University of Florida. We had a meeting not too long ago, similarly around the COVID discussion. So again, we will try to follow the same format. We will allow our guests to give their update. And then of course we have an update from, I believe, the superintendent of Alachua County Schools. The health department will receive an update on the CARES Act funding, and then an emergency management update. I spoke with Chair Hutchinson, and we would like for there to also be an opportunity for city and county staff to discuss some potential changes to outdoor activities that they have been kicking around. And so we'll have that at the very end. With the chair's permission, I'd like to make a small adjustment to receiving public comment. We want to make sure that we finish this meeting on time so that everyone can get back to their busy days. So with the chair's permission, I'd like to waive the rules and allow for 2 minutes of public comment for each member of the public and limit it to 30 minutes for each segment. All right, so we will go ahead and get started. Dr. Lane, welcome. I will pass the floor to you and you can begin your presentation. Thank you very much.
Thank you, Commissioner Ariel. Thank you all, commissioners. It's a pleasure to be back again. Last time I was joined by Dr. David Nelson. Today I'm joined by my friend and colleague, Dr. Mike Lizardo. Mike leads our Screen Test and Protect program, and he's a fantastic epidemiologist, and he and his team have been doing a great job keeping all of our efforts on track. So I'm going to talk for just a few minutes and try not to repeat what I said last time. We've obviously had a lot of students moving back to Gainesville, and we've got about 55% of our students moved into the dorms this time. More on that in a minute, but after I'm finished, I'll turn it over to Mike, and he may make a few remarks, and then we'll open it up for Q&A, which may be the easiest way to go. So if I could have my slide deck available, I'd appreciate it. Does anyone have the slide deck? There we go. Thank you. All right. Again, joined by Mike Lizardo. So Mike, thank you for being here. I don't know if I touched on this very much last time, but 91% of our employees have been cleared to return to work as of this date. You see the number there. The Screen Test and Protect program has been really rigorous on this front, and 63% of our employees have opted to be tested. So we feel very good about that. 15,000 folks have been through the screening, and we've identified some positives. We see that as a real contribution in many ways, because it's prevented those people from coming into the workplace and possibly spreading the virus. We still have the alternative work location policy in place. About 2,000 of our employees are taking advantage of that for various reasons. So they may not be coming back literally to the workplace to work on campus. So I just want you to know that most of our employees are going to be back on campus, but some will remain off campus for various reasons. Next slide, please. The students have been very active. I just want you to know, generally speaking, our enrollment remains about the same. We're down about 1,000 from last year, but last year we really had a bumper crop of students. So we're back down to about where we normally are. We're not going to see quite as many people in Gainesville. A number of the students have opted out, as you'll see in a minute, of their housing contracts, but still we're going to see a good portion of these students back in Gainesville. We had aimed for 6,550 students in the incoming freshman class, and we had some melt, and we got down to the number you see here, 6,455 in this incoming freshman class. And of the registered students, 99% have been screened, and 6% have opted in for testing. Not as high as the employees, but remember too that many of these students were not back here in Gainesville, so the conditions were a little bit different for them than they were our employees, which may account for the lower number. So that's kind of where we are on that front. And remain mindful also of the fact that we have given the students the option to test at any point during the semester. So we may see that number go up. Next slide, please. So in terms of the fall academic delivery, I know I talked about this last time, and it remains the same. About 35% of the course sections are scheduled to be held in face-to-face or hybrid modes. All the lab classes and things of that nature, and some other lectures. An additional 35% of the sections are scheduled to be delivered in a synchronous online format. The remainder would be asynchronous online. We've encouraged the faculty to come up with a continuity plan in terms of the classes. If for whatever reason we needed to convert, make additional changes to class delivery, we've encouraged them to do that. And you see the note about Thanksgiving. I think I mentioned that last time. We want to provide options for the students to try to remain home after Thanksgiving if possible. And so I think our instructors have created course syllabi in that way. Next slide, please. So here you see some notes on the housing, the undergraduate and graduate and family housing that we see. Residence hall contracts are down. We initially had made a number of beds available for quarantine purposes, but when we gave students the option to opt out of their housing contracts by July 15th, we had a number of students who opted to take advantage of that. And so our current occupancy is 73% for the undergrads, 76% for the graduate and family housing. And you see the number of available apartments and beds we've got on campus now, nearly 2,400. We've isolated or set aside 400 beds for quarantine and isolation purposes, and Dr. Lizardo will talk in a minute about how important that number is. That may be a more important number than the number of ICU beds we have available. We know that we will have some cases, and we know the need to isolate and quarantine our students, and so we want to make sure we've got sufficient beds. And so we may have to shuffle some of those other 2,000 or so beds around to make more beds available. But as of now, we have these 400 beds. We have the rights union as a possibility, and we've talked to some off-campus hotels about the possibility of using their facilities as well. So we feel good about this number of beds available. And I think this has really hindered a lot of other campuses that you've seen around the country that have had to change their plans for the fall as a result of not having enough beds. Next slide, please. I wanted you to know that in July and August, we went out with a survey of our students. We wanted to see how they felt about maintaining their success in school and what gave them stress. And so we had a number of responses, nearly 5,200 to the survey for undergrads and graduates and professional students. Next slide, please. And this gives you some sense of how they felt at that time. 97% of the undergraduates indicated they intended to re-enroll in school. Some were a little unsure. As you can see from our enrollment numbers, the registered students, most all of them decided to come back to school. So we feel really good about that. In the undergraduates, those who felt like they wanted to return to campus at that time, 77% said they felt confident they would want to return. Another smaller percentage were not so sure. And then you see on the right-hand side the graduates and who intended to return to and re-enroll and those who intended to return to Gainesville. Numbers a little lower there, which actually surprises me just a little bit that those numbers wouldn't be higher than the undergraduates, but there are a number of factors going on there, I'm sure. Next slide, please. These are some of the top concerns the students expressed. The first three categories you see there, financial support, career planning, and part-time jobs, really have a lot to do with finances. Were they going to be able to get a job, pay off some loans and things of that nature, be able to pay for their apartments by having part-time work and just getting financial support. So between the undergraduates and graduates, those remained three important concerns. The remainder, really, I think a lot of them contribute to this notion of stress that they may be feeling. Would they be able to get some accommodations in one form or another? Would they be able to graduate on time, have access to instructors, access to tutoring, the libraries? You probably saw the article in the Gainesville Sun this morning about the number of students we were going to have to cut back on in the libraries to be able to have sufficient spacing. And then counseling. Our counseling centers have remained open, and we know that we're going to continue to see activity on that front. Next slide, please. Campus events and gatherings. We are not scheduling new non-UF person group organization requests through August 31. You see the maximum attendance there in the first bullet, 50 persons or indoors or 250 outside. We are encouraging virtual modes of participation where possible. You see where we're requiring face coverings and physical distancing. And when we do have an event, that last bullet, we're asking the event organizers to keep track of the attendees in case we need to do some contact tracing later on. Next slide, please. Everyone's very interested in athletics, particularly the football season. Our student athletes are largely back. They've been coming back in phases, as have the coaches. They've all been COVID tested. And the access to the athletic facilities has been changed slightly to make sure that we minimize exposures where possible. The facilities are being sanitized each and every day after each workout, and all the on-campus residence halls are available for the student athletes and have been for a while now. You see the schedule on the right-hand side. The first home game, South Carolina, October 3rd, and then we've got LSU, Missouri, Arkansas, and Kentucky. We are hoping we can get through this season. We're obviously paying attention to what goes on in the other schools that are participating, so keeping our fingers crossed there. Next slide, please. There we go. Continuing to collaborate where we can with the city and others. Really excited about this pledge that our student body president, Trevor Pope, helped us come up with. You see it there on the right-hand side of your screen. We've opened this up to students, faculty, and staff. And we've got some video clips of the mayor and others that folks can turn to and look at as they go through and consider the pledge. So very glad that we went through that process. We've been working with Lee Feldman, city manager, and others, and bar owners to figure out a plan that we might be able to get them open and allow for some extension of premises to allow for some activities outside of the buildings and hopefully provide some opportunities to prevent exposures that might have happened inside the buildings. And then you see the reporting and student conduct piece here on the last bullet, last title there. The 311 line is available for reporting off-campus violations, and on-campus violations will be addressed by our student code of conduct. So we're taking that very seriously, and we've had a few instances where we've had to invoke that. Next slide, please. So I'll just close with these outstanding challenges that we've got. Childcare, we know, is going to be a challenge for a number of our employees, even in our own Baby Gator facilities on campus. We can house we can handle about 345 children in those facilities, but our numbers are down to about 235 right now. So we're at about 70% capacity, which means the number of families that were served are not being served now because of physical distancing issues, employee issues, et cetera. We know that if children are going back to school, that this could create some problems for some of our employees to be able to come to work. So childcare is a challenge, quite honestly. The students self-monitor and isolate. Dr. Lizardo can speak to this. Really, we are encouraging our students to be honest that if they're not feeling well, that they would stay away from class and that they self-monitor and isolate. And this is true of employees as well. So, but it will be a challenge, and we're going to have to continue to reinforce this point. We feel like our supply chain is holding up well. I mentioned last time we purchased 1.4 million or so masks, and we still have 600,000 or 700,000 masks available. We have N95s, KN95s, and regular disposable masks. We've issued masks to all of our students. There's a kit each student receives, has masks in it, reusable masks, and other equipment, other supplies. So right now we feel very good about our supply chain. The gatherings and events, I think, will continue to challenge us a bit, just by virtue of not knowing necessarily where all the gatherings and events are, both on campus and off. Obviously, we're concerned about students gathering in various spaces and not having enough distancing, not wearing masks. So we're monitoring that. And so I suppose if there was an ask that I have today, and I've talked to a couple of the commissioners about it, is that we try to get our law enforcement officers, officials together to talk about coordinating at an operational level what goes on between UFPD, GPD, Alachua Sheriff's Department, in order to be able to really help control and manage what goes on off campus, especially on private properties. I know I was in a meeting yesterday or the day before with Chair Hutchinson, and this was discussed a little bit. We need some clarity on the maximum number of individuals that can gather socially in any kind of updated emergency order, I think. And the emergency order needs to be, as I said, fairly clear, I think, in terms of what enforcement options we've got. Our UPD officers have begun to do some policing with GPD, but we're really limited in terms of what we can do. If there's underage drinking, then obviously we can use that as a nexus to maybe take better control of some of these events, but we're really pretty limited other than that in terms of what we can do at this point in time. So I'm hoping we can address that challenge. So, Mr. Chairs, those are all of my comments at this time. I'll turn to Dr. Lizardo. If you want to take my slides down, that'll be fine. Mike, any comments you'd like to offer at this point in time?
Yeah, so again, thank you very much for inviting us here to be part of the City County Joint Commission meeting today. And just want to take this opportunity to just kind of briefly talk about where things are in terms of UF Health and our capacity at the moment. Go through that pretty quickly and then focus on, I think, what's on everybody's mind and kind of what's the state of students arriving, state of testing, and kind of what is our plan moving forward. And I'll just touch on those and then obviously have the opportunity to address questions as they come up. Real quickly, we're in a little bit better spot than we anticipated with the epidemic when we saw the numbers go up in the midsummer. They were going up quite a bit and actually got us to be quite concerned, and all that media attention, all of you are very familiar with what was going on. I don't want to steal Paul Meyer's thunder here in terms of what's been going on in the county, but what's been going on in the county and what's going on campus is pretty much reflected in what's been going on throughout the state and most of the Sunbelt states. Our cases peaked in about the 2nd to 3rd week of July, and that was reflected not only in the number of cases in the county, but also in the number of patients that we were seeing in the hospital. Our census in the hospital, if you may recall from previous presentations, peaked at about 90 inpatients with COVID, well within our capacity to withstand the surge that had occurred. Obviously, we don't want to see anybody coming in the hospital. We want to see those numbers stay low and no one getting that sick to have to come in. But if they come in, we were able to handle that. In addition, we've seen that people have modified their behavior. The use of masks has resulted in, we believe, is what's resulted in cases dropping inexplicably, and they've been able to go down. And again, there's all the nuances about testing and different things, but we really feel that this drop that we've seen in the last 3 weeks is real. The census in the hospital now is hovering at about 70, actually about low to mid 60s, kind of bounces around a little bit. And that's been good. So you expect to see hospitalizations drop after your peak in cases, and then the deaths will also drop as well. So these are all good markers. So also, we've also seen just in the county, just to kind of give you some numbers, I'll let Paul go into those in details, but we're almost about 60% of the cases that we've seen on a daily basis and weekly basis of what we were seeing there a little bit over a month ago. So those are all good signs, but we know that it's not gonna stay that way for a variety of reasons. One, we know that kind of what all the modeling and all the science has shown is that there's gonna be ups and downs with the epidemic. And we all think that if you look at the models related to what happened in 1918, so the great influenza, the model that most people look at that most closely mimics what we're going through, there was a peak in the fall, but that peak wasn't directly related to just school. There were a number of different things that happened at that time that make us think it may be similar this time as well. Again, we're trying to gather as much science and evidence as we can, but it's not completely clear that this is going to be a good comparison to what happened with the flu. So we're doing the best that we can, and obviously we'll share that information as we get it. So really, what's happening now? So let me just kind of focus on kind of what's the path forward. And I think that that's really kind of the $1 million question, right? What are we doing as we move forward? We know that our anticipate cases to go up. What exactly are we doing? So the Screen, Test, and Protect program, that many of you have heard that name, and I've got this nice graphic here. If I don't have it, it otherwise looks like some sort of video shot in my garage. So I'm in a conference room here that's pretty stark, so the background, I think, kind of helps kind of make our point. Screen, Test, and Protect was much more than the return to campus plan. So most of us on campus, and as Dr. Lane pointed out, looked at screening before coming on campus and testing before people come on campus. But again, a one-time shot is limited, right? So you can develop symptoms 2 days after you fill out the questionnaire, or you can go to a party or go to a bar and then develop COVID after testing negative today. So again, that testing and screening is of value. We have found cases, surprisingly, with the questionnaire itself, we found people that said they were symptomatic. We had them tested, we found them as cases, and we isolated them appropriately and identified their contacts and quarantined them. So it has had an effect. But like so many interventions that we have, they're imperfect. And so there's a series of different things that we put into place that reassure us that we move forward. Let me be very honest with you. This is a difficult, challenging time. And I know it seems obvious to state that, but as scientists, epidemiologists, as physicians, public health practitioners, we're concerned. We share the concern that exists in the community and that you as leaders share as well. But I want to give my reasons for why I'm optimistic. And again, that it's not just crazy optimism and blind optimism here, but it's bounded, what I call bounded optimism. There's reasons for it. And the reasons are that we've got science and evidence that we're building and learning as we go along and talking to peers and learning from others and going through the literature and using the best practices to kind of help us move forward. That said, we know that our process isn't perfect, and we know that this will change. And like everything in our lives these days, it is subject to change. I think those will be dirty words here in a moment. We hear this so often, and it's just such an indicator of our times. But we'll continue to kind of move forward. So as I talk about our testing plan, let me just say one thing up front. If I had my way, I would say that I would test everybody at UF. I would test everybody in the state of Florida every 2 weeks and have the ability to contact trace, isolate, and quarantine them. And that's really kind of what the pandemic playbook said originally, is that test as much as you can, have the ability to isolate and contact trace and to quarantine people appropriately. And then eventually that'll buy you time to get the vaccine. Obviously, we've got all these imperfections and challenges that we face nationally, the supply chain problems that we have in terms of testing and some of the other challenges that are out there. These are real. But I've learned through my own personal experience and going through personal crises that many times when you're in the midst of a crisis, the question isn't always to ask why. Why did certain politicians make these decisions? Why didn't we have this available? Why didn't that happen? I think those are questions that are very valid, but perhaps not for right now. To me, the question, at least in my role in this capacity, has been what now? And for us, what now has been Screen, Test, and Protect, which has been this public health surveillance project again, through a unique and very powerful partnership with Paul Myers and the Alachua County Health Department and surrounding health departments, as well as the Florida Department of Health based in Tallahassee, that allows us to go beyond just that initial screen, to go in beyond that initial test, which again, with all those imperfections, we have backup plans. So besides that initial screening and testing that we do, and just to kind of review some of the numbers, about 30% of the students, undergrads, as they're coming in, are opting in to get tested. All of them are having to be screened to be able to come on campus, but that test portion is only roughly about a third. But 70% of those that are in residential facilities, Greek housing in the dorms, are being tested on arrival. And then we have picked up some cases there, have isolated and quarantined them appropriately, and actually have tested the system this past weekend where we did rapid response testing. Unfortunately, found no other cases, but again, testing the system and really looking at kind of this ongoing testing process. Again, even the universities that have been able to do that are smaller or have other resources, they've been able to innovate in ways that we're still working on and ways that we've already innovated on. Even if you test everybody at time zero, we might all feel good, but they can all get infected later. It's your ability to continue to test, to continue to monitor, and then to isolate, contact trace, and quarantine appropriately. That's what's going to keep you in the game. That's going to keep things safe. And as we like to say, slow the roll. Again, we're in the midst of a pandemic, so the idea of having no cases is very unrealistic. To define safety as meaning no cases of COVID is also very unrealistic. There will be. But how do we protect the vulnerable? And the vulnerable are not just the students whom we care about, but it's going to be the staff who are going to have a higher incidence of diabetes, high blood pressure, and obesity, and other things that will put them at greater risk. And how do we protect the most vulnerable? Nursing home, long-term care facilities, and other individuals. So those are parts of our plan as well. So by slowing the roll, we're going to be doing this ongoing testing. So in other words, we have that rapid response testing. We're going to offer testing and make it available for those on campus throughout the semester. We're also doing pop-up testing that's going to focus on higher risk areas, so the congregate settings and also places where there's on-campus learning. So not that the learning is going to be a problem, and not that the sort of setup that we have with masking, physical distancing, and the other things that we've got in place, but we want to test the system. Is what we are doing working? This is really, at the end of the day, we assume all these things work, and there's really strong evidence and growing evidence that it does, but we want to know if it's working here. We don't want to know that masks are good anywhere. We want to know that masks are good here. So in other words, I really want to know what's happening on campus with transmission. So the system that we put into place, we're going to put in a system of weekly symptom assessments, weekly screens. We're going to be doing these pop-up tests that are around, and also targeted testing throughout to do what we call surveillance testing all throughout the semester, where we're expecting to do tens of thousands of tests over the course of the semester if we continue to be able to put things in place as we like. Again, there's some innovations that we're working on. Some of you may have heard of the Yale test and saliva tests. Again, I won't go into the details here because I probably already talked too much. I don't want to go into those details, but just know that we're innovating and looking at new ways to do things, and not just staying with the innovations and things that we've done here, which have been sizable. We've been able to tenfold increase our testing capacity. We're doing thousands of tests a day. We've got that capability. So we're not going to rest on that. We're going to continue to do that because philosophically, we believe testing matters. And at the end of the day, has anybody ever had a case of anything prevented by doing a test? The reality is what happens after that test. So our ability to screen, to be able to do the test and then follow up on it with contact tracing, appropriate isolation and quarantine is critical. So we look at our students, our faculty, staff, the rest of the Gainesville community as partners with us to follow along when we say, hey, we need to know your contacts. We can quarantine them appropriately. We need to have you isolate and really stay in isolation. We'll check on you. We'll do these other things, but really we're all in this together and really look at this as a way to, exercise your altruistic beliefs to be able to help your community. So all those things play a role, but because of our partnership with the Department of Health and Paul Myers very specifically, we have a very, very strong contact tracing team that, despite all of you've heard of stories around the state and around the country that have not been able to pull it off, in Alachua County, we are, and in surrounding counties, we have been, and on campus, we have been. We successfully reach out to 100% of cases that are identified as having COVID. We cross-match the lists that they get reported, to the state and to the county, and we cross-match that with the UF person list, identify any cases that we may not know about. We contact trace those, and we only have about a 14% loss to follow-up rate for people that we initially identify. When you compare that to national standards, it's wonderful. It's incredibly high, and the county has similar rates as well. So again, and with that, we don't just contact trace to say, hey, who do you know? Tell them to call us. We actually collect pretty detailed information. Those interviews take 30 to 45 minutes where we get a lot of information, a lot of data. And you can say, okay, well, that's fine. That sounds like an academic exercise, something that makes university people excited. This is actionable evidence. So in other words, we figure out where transmission is occurring, because at the end of the day, that's what we want to know. We want to know, where are the gaps? Where are we missing things? Are masks working? Are they not working? We know overwhelmingly now that the evidence is that they do work, but were they really wearing their mask? And what happens when one person wears it and the other doesn't? We're actually collecting that information now. So again, I do that in kind of my sort of lead into what's really the big question I seem to be asked over and over and over, is that what are the triggers for us to stop doing what we're doing? When will you close down the university, or when will you stop doing X, Y, and Z? Again, that's a complex decision that certainly yours truly is not the one to make that decision. I will tell you that we will present evidence when there's something that we think needs to change. And I will tell you, even without someone from UF leadership here, I would say the same thing, is that UF leadership has been exceptionally responsive to us when we present the science, because we committed very early on to, we're going to drive this by the science and evidence. So if there's science and evidence to support it, we're going to do it. And if there isn't science and evidence, we're going to use the consensus of experts and what our peers are doing to present the best plan forward, and then collect that evidence. So what are the things that would lead to a lockdown, or us to recommend a change in state? One is hospital capacity. That's why we always bring up the hospital. Fortunately, during this last wave, which really was about 2 to 3 times the size of the wave that we had in April, probably about 3 times the size of the one in April, really didn't even get us close to limiting our capabilities at the hospital. Again, we don't want to get there. We don't want to test the system, but we stayed well within our capacity to keep people with COVID and without safe in the hospital, and maintaining safety there and lack of transmission there. So that's a big plus, and one of the main reasons why I'm optimistic. The second one is that we want to look at is student health's ability to handle the number of students that may seek care there. Again, we're staying well within our capacity there, and we'll monitor that closely, and then have alternative plans to be able to move that around. Another one is our isolation and quarantine capacity on campus. Dr. Lane showed those numbers there, but those are numbers that are going to be very flexible, and we're looking at ways to augment that and increase that. So there are ways that we can isolate and quarantine those who are in residential facilities. Now, let me just remind everyone that if you are a UF student or a UF faculty member or staff member, or anyone in Alachua County, you isolate and quarantine in your home. That's where you go, and you stay in your private home, and we follow up with phone calls and emails and make sure that you're doing well, and then take the appropriate steps from a public health standpoint. And we support you there as well. When we talk about isolation and quarantine facilities on campus, we're talking about for the 8,593 residential students that are on campus in Greek housing or in the dorms, and also married housing as well. So if we have to isolate them, we don't keep them where they are. We move them to one of those residential facilities that we've now set aside as isolation and quarantine. We can expand that. We've got some flex there. We've got some room. We know that that's, as Charlie had mentioned, was that really that's a critical part and as important as what goes on in the ICU. So we recognize that. So again, to give you an exact number, what a lot of people say is that, oh, when you hit 10 cases, 50 cases, 100 cases, UNC had 130 cases and they closed. Why are you not closing? And you've had hundreds of cases on campus since May. The reason is that we haven't hit those main markers. And let me just kind of be careful in how I say this next part, because I've tried it a few times and I've kind of gave people the wrong impression. So just bear with me as I kind of go through this, because I think, to be fully honest with you, we need to ask ourselves, what does a lockdown really do? It's an important tool. It's very important. We know that it's got a double edge, right? So it closes things down, it puts people out of work, it complicates things in so many different levels. But locking things down or shutting down parts of a society or of a community is effective. It slows down the spread. So that's the key. It's the spread. I can't make numbers go away unless my lockdown affects the spread. So when we did that lockdown in, what was that, late March, or actually started in April into the beginning of May, it stopped the spread in the community as a whole because we shut everything down. But we can't really do that again, right? We want to avoid doing that for a variety of reasons, of which we don't have enough time to go into here. But the same is true for other institutions and other places. So in other words, if we find that there's spread on campus that is not controlled, That to me is far more important than to say we had 100 cases last week or 200 cases, or it was 200 last week, now it's 300. Because if those individuals, be they students or anybody else, are getting that outside of campus, my locking down campus is not going to do anything to protect the community. It's going to just stop spread on campus, which we're monitoring very closely. If it's not happening by locking it down, it's still not going to be happening, but you're going to have spread in other places. So that's why the focus on bars, which we had identified and others throughout the state had identified as places where transmission occurs. Bars normally practicing what they do was the source of transmission. They were recommended to close down. They can modify, they can do other things, and then we learn from it and see, is spread still going there? Nothing against bars or bar owners. Obviously want to support those and support all of our community business owners, whatever they might be. But again, we learn. So if transmission or spread is going on, we shut it down, we make changes, we learn, we collect data, we move ahead. So again, it's almost like this game of whack-a-mole, right? The rates go up, we try to smack it down, find out where it's going from. But again, we're committed to the science and the data. We collect that data. And I will tell you right now, we are looking so closely at what goes on campus, because to me, the number I'm more concerned about, not the total number of cases. Yes, I worry about that. I want to see fewer cases and I don't want to see transmission at all. But I'm accepting a certain amount, because what I'm worried about is the University of Florida being open, causing spread and making it worse overall? And is there anything we can do to slow that down? And if my answer to that question is no, there's no spread that's happening here, because the mask policy that we've got in place, the physical distancing policy we have in place, the decreased concentration of people that we have in place, and all the other things that we do with hand washing, the signage, all the things that students, faculty, and staff are doing, if all those things are working, locking down doesn't make a difference. But if it isn't working, guarantee you that we're going to be the first ones to say, guys, something isn't right. They're not wearing their mask, or they are wearing the mask. We need to change X, Y, and Z. We're going to have the science and the data drive what we do, so that policy isn't based on emotion or just an arbitrary number that makes us uncomfortable. We want numbers to indicate something real that we can do differently, so that we can communicate honestly with people as to what's going on. I have no skin in the game. If what we're doing is not working, if we find that masks are not protecting people that are face-to-face, if we find that we are not, we are getting a lot of spread, and we do, what we call RNA fingerprinting, or looking at the genetic material of the virus to prove that clusters of cases are happening and we cannot control those, I'll be the first one to say, we got to stop. We got to do something different. Now, there's a whole complex series of processes there that, again, are outside of my legal expertise, which is close to zero. But again, we will convey that to leadership, to the community, to the county, and share and say, this is what's going on. And again, because of our close relationship with the Department of Health, and Paul and I and our teams meet every week and we talk pretty much every day, that is not going to be a surprise to anyone. We will share that regularly and we'll work together. So again, that was probably a lot more, Charlie, than you probably wanted me to say, but I thought it was important to kind of lead into these really important questions that I think are really at the heart of things. Just know that we're humble. We want to break that academic sort of stereotype of being arrogant and kind of thinking that we know more than everyone. Everybody on this call in the community and every one of the commission, we can learn from each one of you, and we want to listen to what's important, because we're part of this community and want to do everything we can to protect our own. We live here. This is our community, and UF is ours as well. And we want to share and keep it as safe as possible, but also just be as honest as possible with what's going on. So I'll pause there. And if there's any questions, I think we'll be glad to take those if there's time, and we'll follow Mr. Chairman, what you'd like to do at this point. Thank you.
Thank you, Dr. Lizardo. Thank you, Dr. Lane. We really appreciate those comprehensive presentations. You do have questions. We will go in order as I saw them. Commissioners, remember to hit your little Zoom blue hands if you'd like to be recognized. And if I don't recognize you, please don't be afraid to speak up. Commissioner Simmons, you are first.
Thank you, Chair. I just want to thank Dr. Lane for coming and just bringing us this update. But I have several things that I would like to say up front. I think in the future, when we have this type of discussion with the county, the city, and University of Florida, it would be helpful to me if we can ask questions during the course of the presentation. Waiting for a whole presentation to end, I had a lot of questions up front, and I just would like a more relaxed dialogue. I feel like I'm being talked to and not really being engaged and having this a real robust conversation. So in the future, we can have that type of format or that type of energy where, this is a very serious topic, and I had numerous questions throughout the presentation that I would love to have had a dialogue with and get my questions answered up front, so I can have a better understanding of what is really going on. I know certain commissioners may have met with Dr. Charlie Lane prior and have had these ongoing discussions, but for many of us that have not had these ongoing conversations and dialogue, it would have been helpful for me to at least could get my concerns out throughout the conversation and have it at more of a relaxed um, conversation and dialogue. And that's just my personal opinion. I just feel like this is just a presentation that's been given, and that's fine and that's dandy, but I feel like I'm being talked to and not really being engaged in the conversation. So the first actual question I had was the very first slide with Dr. Charlie Lane, where you talked about the employees were offered an opportunity to opt in, Dr. Lane.
Yes.
And I just wanted to know exactly what was that. I was confused because they was the very first slide. I'm trying to reach back to my notes. Give me 1 second. The employees were offered an opportunity to be tested and they have an opt-in option, but also it says that screening is mandatory regardless of location. So I'm kind of confused. If screening is mandatory and you're supposed to be tested, they also have an opportunity to be opted in and be tested. I just want clarification.
Sure. And Dr. Lazaro can help out here if necessary. For both students and employees, Commissioner Simmons, all of them have to go through a screening process. They're required to answer a series of questions. They don't have to take the testing. They're offered the option to opt in for the testing. But we're making testing available for all of our employees, for all of our students. And so as you see, the percentage that opted in decided they wanted to go through the testing after they'd been through the screening for both the students and the employees. But every one of our employees and every one of our students will have been through the screening at the very least.
Okay, and the screening is mandatory.
Correct.
Okay, but you can opt to be tested.
Correct.
Okay, thank you for that clarification. And Dr. Lane, you mentioned about this, you wanted us to really work with GPD, UPD, and the sheriff office. What concerns do you have? What limitations do UPD have? And what are your concerns?
It's a good question. I think what we're trying to do is those off-campus gatherings, Commissioner Simmons, that many of us are aware of, we don't know where a lot of them are. And if there's a noise complaint, for example, and our officers, if they were to accompany Gainesville Police Department or the Sheriff's Department, there's not much we could do other than show up and really counsel students and say, hey, you shouldn't be together in such a large number, and or at the very least you should be wearing masks. There's not much we can do beyond that. If there's underage drinking, that's one thing. But beyond that, given some of the, I think, differences of opinion about what our authority is in those cases, we're kind of constrained. And as Dr. Lazaro pointed out, and as I have, that's one variable that we have a difficult time controlling. We would like to be able to, I think, be more effective in that realm. And I would just encourage our law enforcement agencies to get together to figure out what language we need to have at our disposal to take advantage of that.
And also with your pledge, I think that's a great idea, very creative. do you have any repercussions for students that will not be wearing masks on campus, or if they violate any rules and regulations? What is your recourse or response to that?
We do. Our Dean of Students Office, which administers a lot of the conduct enforcement, is we're working closely with them. But for example, if we see if a student were to come to class without a mask, that faculty member has the prerogative to ask that student to leave. If that student doesn't, we've instructed the faculty members, they have the prerogative then to dismiss the class. If that student shows, and then that student would be, their name would be given to the Dean of Students Office. They would consult with that student. If that student did it again, we'd take much more stringent actions after that, including possibly dismissal from school. And if necessary, we might even ask our own police to escort the student from the classroom.
Okay. And one last question. What's the relationship with the University of Florida and your essential workers? For instance, if they become ill or they have some concerns, is there a process in place for them to go or speak to someone about their concerns? And if so, do you offer any long-term or long-term help or assistance to maybe family members? Maybe if this person was affected by COVID and they live in a multi-generational family, what's the extent, how far do you all go, and what role do you play in assisting those essential workers if problems should arise or concerns are brought to your attention?
I think we'd have there's some limit in terms of what we do with the remainder of the family, but I'm going to let Dr. Lizardo speak to the extent to which contact tracing efforts might assist in that regard. Commissioner Simmons. Mike, you want to handle that?
Yeah, so when we find out about a case, we make sure do the in-depth interview, but we also make sure that they have access to food and access to other things. We don't have resources to provide them necessarily for every case that comes through, but we do make sure that they are in a good spot. If they are not, we can refer them to social services and kind of get them connected to make sure that they're in a good place. That's something obviously that's consistent with what the county does as well. We're focused on the contact tracing, and we are focused on getting them taken care of. But clearly, we're healthcare providers, right? So we care about them as a total person. And so if there's a need that's there, we make sure that they get that, including psychosocial help as well. In terms of the people who have symptoms on campus, so on the staff and others, so they would be able to access care and get tested. So one of the things that we're facilitating is testing for anyone who's part of the UF community to get tested as soon as possible through our system. So if someone were symptomatic, there's a process for them to isolate, get tested, and then decide if they're clear to come back to campus or not. And that's the same for faculty, students, or staff.
Okay, and one thing, I'm sorry, one last thing, Dr. Lizardo, you made a statement earlier, and I wish I could have just gotten more feedback from you, but you stated that the number of cases, and I know I'm just paraphrasing it, and
Sure.
I can't say it verbatimly, but you stated like the number of cases that really wasn't a main concern. However, it was a concern, but your concern was, and can you elaborate on your concern? Yeah.
Yeah. So let me do this. So the first thing I would like to say too is that just as an aside, your comments earlier really I took those to heart, and that's something that we're trying to do on campus and with the community. So if we can talk offline, you can go through the universe, however you want to do it, but we'd be very happy to engage in a dialogue and a conversation offline or in a different forum and be able to answer those questions, because there's a lot, and really I want to hear what you have to say and other commissioners, and so we're always available for that, because this is a big deal and it's not always straightforward. So really want to respect that, and whatever forum, phone call, town hall, whatever you want us to do, we're available. And again, like I said, somewhat selfish, we learn a lot from that and want to address that. So we learn a lot, but also want to provide that service. Let me kind of clarify that question about numbers, because it's again, I care about the total number. I wish I could make the numbers go down to zero, right? But I know that I can't. And what I can control is the spread on campus. I can't control what goes on in the community. So when I say I don't care about the numbers, I care about the numbers. What I mean is that I can't do much about what goes on somewhere else other than as a general, these are the rules, try to stick by them, but I have no authority or ability to change that. On campus, it's a little different. So in other words, I can't say, okay, there was spread at a house party on the northwest side of town, or there was a gathering at a social event in the south part of town, and this happened. I can't really control that, but on campus, if there's spread and I know that people were wearing masks or I knew that other things were going on, it really gives me an idea to understand what's happening. And that to me says, like, guys, even our best efforts, they're failing. We know that they're spread. So spread isn't just we have cases, because those cases can come from the outside or they can come from the inside, right? So you can either get COVID on campus or you can get it somewhere else. If you get it somewhere else, I can't change that. I can only deal with it when it comes in. So if you're a UF person, you get COVID in South Florida, Central Florida, wherever you might live, and you come onto campus, as soon as you get it, and I know it, we can isolate and quarantine you and get your contacts done and nip that in the bud really quickly. If you are here on campus, you're doing what you're supposed to, and we're not enforcing the mask policy, or we've got the mask policy and it's not working, and you get COVID when you're here, and we can prove that, that bothers me. Then it's like, guys, what we're doing isn't working, and there's something that we're doing that's going beyond what happens in the community. So our goal is to make campus itself safer than the community in general, or at least as safe, but certainly no worse. And if it is worse, I think that's one of those triggers where we say, guys, we need to do something different here. Did that help? Did that clarify it some? I know it's—
Yes, that did. Thank you so much. Thank you,
No,
Chair.
Yeah, and I sincerely mean that. We'd love to have a conversation. If there's other questions, we can keep talking. We'll be glad to listen.
Thank you, Commissioner. And there are more questions. Next up is Commissioner Reynosaco.
Thank you, Mr. Chair. Mr. Mayor Pro Tem. There we go. So last night, an article came out saying that Tuscaloosa had 560 new cases after their first week back. And I understand that one of the main differences between Tuscaloosa and Gainesville is that bars were open. That said, our bars are closed. We still allow consumption in some kind of way, but I'm honestly and sincerely worried about house parties. I'm worried that, 50 people being allowed to gather is maybe 45 people too many. I want to know about enforcement. I know that we've talked a bit about the concerns of UPD and what their range is and how far and how much they can do. I don't want someone calling the police because there's a party. I think that elevates things to an extreme we can't back down from. And we're trying to move away from that reaction. But, and this might be, Mr. Feldman might want to come on and let us know something about this. Is there a way to have codes after hours? Is there a way to partner someone who isn't a police reaction after hours? Because we know we're going to have these parties. We know that people are going to be off campus gathering and parking large numbers of cars. And if nothing else, I think bars and a house party don't have much of a difference. It's going to be people in close quarters, drinking without masks, not taking precautions, losing the majority of their faculties as they continue to party and drink. And that's going to lead to 500 cases here. I am dead certain of it. So is there one way that we can have codes available after hours as an extension of the police department? So it's not UPD or GPD showing up. Is that something that could be possible that you think might be a better response?
So Commissioner, we've been looking at the whole response issue and what enforcement mechanisms are available under the order as it exists now. And based upon our reading of the order, the order to disperse and the effect of non-dispersion is basically a second-degree misdemeanor, which would have to be witnessed by a law enforcement officer to get further enforcement on. So as the order exists now, while we do have our code compliance officers and GFR inspectors working after hours and going into businesses, in this particular case, the remedy would be a law enforcement remedy. And I think that's what Dr. Lane was referring to, is that we need to work together with the various law enforcement agencies to develop a different protocol, where, ultimately, I think, law enforcement would be the last remedy. But right now, there is no civil citation remedy that we see where basically a ticket can be written by a code compliance officer to whoever's hosting the party. So I think that's one of the things we're looking to get changed.
Okay. So moving in a completely other direction. Thank you, sir. I had to send my little sister back to college this week. And one of the things that makes me comfortable is knowing that her school is requiring mandatory testing every 2 weeks. And I know that you said that the students will be screened and they can opt in and they'll have testing available. But is there any way to make it mandatory, saying, if you don't come in for testing by this deadline, there will be some kind of academic repercussion if you don't come in and get tested? I think, Dr. Lizardo, you said, consistent testing and tracing is what makes it work. And you could be asymptomatic, so you don't go to student health because you don't think there's anything wrong with you. But if you're getting consistent mandatory testing, that can show you what, if you are asymptomatic but carrying and spreading. Is there any way to do that? Maybe not at 2 weeks because we are a much larger school, but is there any way to require consistent or routine testing?
Yeah, so a couple things. So you bring up some really good points there. So there are a couple things. The main one to kind of remember is that I suspect that your little sister goes to a smaller school, correct?
Yep.
So that's a key part, because it's the issue of scale. Because of, again, getting back to those decisions that we made on a national level in terms of our testing capability, we can't do the kind of testing that we want to do anywhere at the level of that would be ideal. So let me just start with the ideal. Let me also just say, kind of again, another grounds for optimism is that the ideal is not necessary. And in fact, this is going to sound like the rationalization of the century, but it's based on data that exists. Even if you can identify 20% of the cases and successfully isolate and quarantine, you start to drive what we call the reproductive number down to close to 1. In other words, you're not spreading to more than one person at a time. So in other words, the epidemic grows, but very slowly, and you can control it just even with 20%. So again, now to stop people from doing the math and say, well, 20% of 50,000 means you need to do at least this many and get that. So again, it's not quite that precise because there's a lot of other things that go in there. Wearing masks, all these other imperfect things that are there. If you ask me again, kind of like I mentioned, I'd really like to be able to say that we can do everybody every 2 weeks. But the main reason why we can't do that is that the national supply chain doesn't keep up with it. So again, the PCR tests that we do use certain kind of enzymes to make that reaction work, and certain chemicals and certain fixers. There's all these different things that have to go into place. All of those are in short supply. All of those, every university, every institution, every state government, every health department, every public school now is having the same conversation and tapping into that same supply chain. So what we're trying to do is to, use the idea that, the idea of life gives you lemons, make lemonade. And so I think we've got limited testing capability. So we're trying to apply that testing capability as wisely and as effectively as we can. I think one of the other things that we look at is just really how effective our contact tracing and isolating has been. And so actually we're working on actually calculating that number, but we know that we've really taken the legs out of the epidemic in a lot of ways on campus because of that contact tracing. You're right. I know the next step will be is that, yeah, but can't you get overwhelmed? The truth of the matter is, yes, we can, but we haven't been yet. And we think we've got enough things in place to be able to continue to carry forward. But like I said, guided by humility and the humbling that the virus has done on us so far, we're always looking to data and always making sure that we look and make sure that we're making the right decision. So again, I appreciate your answer, and I couldn't agree with you more, but I think it's just the real life challenges that we have with being able to scale up. We're looking for ways of doing that, using different sort of not only innovative, but sort of unorthodox ways in doing the testing. And so there's more on that later as we kind of find ways to move forward.
Mike, I'll just also add to the commissioner's question that there are legal challenges around, as you know, requiring, mandating testing. I think we've done the absolute best that we can in the absence of legally requiring students to do this. We have in those cases where students have contact with patients, as you know, or they're in a face-to-face setting that they can't avoid. But otherwise, I mean, making testing available to the extent that we have and doing the surveillance testing that you're talking about is a pretty good second place.
And just last question, if you would. We have 400 beds available in case anybody does have to be isolated. I hope we don't get to this, but what happens if you get more than 400 sick students or faculty?
As I said earlier, there are other beds on campus. We have to jostle them around somewhat to make some of the additional beds available. That does remain an option. We have a hotel on campus that we could use as well, the Wrights Union Hotel. We'll also remind everyone that the students that are on campus many of the students who live off campus will remain off campus, as Dr. Lizardo stated. And so the likelihood of us running through all of those beds with on-campus students, I think, is reasonably low. Mike, would you agree?
I would agree. Yeah, that's an important reminder, is that those isolation quarantine beds are only for students in residential housing on campus. And as Dr. Lane said, that can be flexed up. We just don't want to get to a number because there's a lot of jostling and moving around that has to happen. But we're aware that that's going to be an area where we can flex up if we have to.
Thank you, sirs.
Thank you, Commissioner. Next, we have Commissioner Harvey Ward.
Thank you, Mr. Mayor Pro Tem, Mr. Chair. Thank you, Dr. Lizardo, Dr. Lane, for being with us today. I really appreciate you making time to work with local government on this. I have a lot of questions, but I'll try to sort of keep it tighter. And some of this will involve Manager Feldman, probably more so than UF folks, as well as Ms. Shalley, and potentially Mr. Libby speaking for our attorney's office. I think it's of paramount importance that we find a way for GPD, ASO, and UPD to work together on a consistent basis on this issue. It's outside of what they often do, but GPD and UPD work together pretty well on underage drinking issues, on issues that surround our normal late night young people disturbances in Midtown and downtown. So this is kind of an extension of that, but I would like for us to find a way to know that on a daily basis there's coordination specific to COVID and all the things that involves between those three law enforcement agencies. So the question is, how do we best do that? And I don't know, I don't want to pretend to know, but I would like our law enforcement leadership to be directed, and I know that that's possible in 2 of the cases, but we can't really direct the ASO to do much. But with the folks on the screen right now, we can direct UPD and GPD to do that coordination. I know there is some level of coordination already, but I would love to know that there's a specific process for that. So could we address that first, and I guess Dr. Lane and then Mr. Feldman?
I'm not sure what to add, Commissioner Ward. As early as last week, I'd had conversations with Mr. Feldman and about teaming up UPD with GPD at the very least, and with the mayor. And we were ready and prepared to do this at the end of the week. And we did some of this over the weekend, but reports we received back from my chief, UPD, it was successful, don't get me wrong, in that we were together and could observe jointly what was going on. There are activities that are happening, but in many ways, the only thing we can respond to are noise complaints at this time. And so we know there are other parties that are going on probably, or gatherings. But there was, as I said earlier in my remarks, we're just limited in terms of what we can do at this point in time. It's just that simple.
Yeah, and Commissioner, if I could just add to that. So the coordination's happening, I believe, at the deputy chief level for both organizations. Assistant Chief Scott and the deputy chief for UPD are talking regularly and are working on the coordinated enforcement. But as Dr. Lane indicated, it comes down to what is the enforcement remedy. And just like the county order has a civil citation for mask wearing on there, I think, at least from our discussions at the city, we would like to see some sort of civil citation option put into the order that would, allow for ticket writing for this on there. I think ultimately, we do have a good communication going between the law enforcement agencies. And even though ASO has jurisdiction, this is primarily a GPD, UPD issue at this point.
So I have, I would make a motion, but I would also like to, I've got a few more things to add after that. I'm going to move that we direct, well, before I make the motion, let me ask Ms. Shalley, Mr. Libby, what do we need to do to make sure that we have a civil citation in place? I mean, that's the motion I'm about to make. So let's make sure we know what I'm doing.
If the city wants to do the civil citation portion, the county order would first need to be amended. And then I believe the emergency order or ordinance that we did to allow us to write a civil citation for mask violations would also allow us to write a civil citation if the county order allows it.
Okay.
Now, and along that line, I would, and adding what Manager Feldman had said, GPD and the University of Florida Police Department have a mutual aid agreement. And it's my understanding that the University of Florida Police Department has full law enforcement authority throughout the city. So they can take whatever action Gainesville Police Department can already. It will just be a matter of them coordinating who, what, details, where they're going. But they already have that authority now to do that under the current mutual aid agreement.
Okay. So then, Mr. Chair, I would ask that you all, because certainly we can't direct you to do that. I won't bother making the motion. If we can make that happen already after the county takes action, that would be really useful to us, I think.
Yeah, let me just say that yesterday's county commission meeting and then the day before the meeting with the university, we've directed the attorneys for the police departments, the 3 police departments, to get together with their operational police officers and come up with not only the language that would be in the emergency order, but any other operational agreements that they need to come up with. The recommendation was to get the politicians and the bureaucrats out of it, put the operational people and the attorneys together, let them come up with the language that they all can agree on, and that would be the best way to give the authority to all the police agencies to order a group to disperse, and if they don't, then to have the sanctions necessary. Now, I'll lean on Charlie Lane for a minute. The UF General Counsel, when they received the call from the county yesterday, could you guys meet, said, well, probably not till next week sometime. So if you could put a little pressure on the UF General Counsel's office to assign somebody. You guys have more attorneys in the city and the county put together, and our folks are ready to meet. So
I appreciate the feedback, Commissioner. I didn't, sorry that happened. So I will plant the seed.
Great.
It's an important issue. We need to get it resolved.
Yeah, I would, and Mr. Pro Tem, I appreciate the latitude here bouncing around with questions. I get that we're off our normal.
Not at all. Please proceed.
Um, so yeah, my fear is that, you know, we'll get citations in place, but that they'll happen at the speed of government, and we can be real happy about having them done in February. And I don't want that to happen. You know, that this is something we need to move as quickly as possible. And I'm scratching my head a little bit why I'll take the blame. I didn't think of it 2 months ago, because clearly this is something we should have had in our back pocket ready to go, knowing that all this was going to happen. But hey, you know, we're moving forward at this point. So let me moving on from that piece, since there's no need for a motion there. Let me ask. I guess Mr. Feldman is the appropriate person, or the most appropriate person, but someone to restate for us what the gathering limits are for personal gatherings on private property, and what what the rules are for bars and restaurants right now.
So Commissioner, actually, I would defer to the county. It's
Fine. Yeah, I can only see who's on my screen. So
yeah, it's their order, and I certainly can comment if I disagree with their position, but
We have Sylvia Torres, the county attorney on. Go ahead, Sylvia.
So, Mr. Chair, the bars and bars are closed by the state currently.
right. And bars are defined as less than half the revenue from food. Is that right?
Bars are defined by how they're licensed.
Okay.
So there are a number of different, and there have been some nuances with that as far as breweries and those kind of things. But they're licensed by the state, and the state has them licensed under different chapters in the statute, and the chapters are the ones that are referenced in the order.
Okay.
As far as currently, our order says that groups or more of 50 people are not permitted to congregate in a space where they can't social distance. So if they're in an area where they can't social distance, then they can't be there. It also says that groups of any number who are not socially distancing can be ordered by either code enforcement or law enforcement to socially distance or disperse. And if they don't, then they can be subject to the penalties. And the current penalties in the order are only the statutory penalties, which are a second-degree misdemeanor for that provision currently, because our provision regarding the civil citations only applies to the mask ordinance, or the mask part of the order currently, because it cross-references that section. There is no language in the order regarding whether it's private or it's public.
Okay. Good.
So, and that was intentionally left out so that there would be some option for dispersing people on private property. But again, law enforcement has to tell you whether law enforcement can lawfully be there. And I think your counsel will tell you that there are some Fourth Amendment privacy issues related to that our orders can't necessarily overcome.
So if codes enforcement or GPD rolls up on a party of 51 people at somebody's house, or let's say they roll up on a bunch of people in the yard at somebody's house, and they're not socially distanced, can they disperse that?
So we would tell our codes. I will let your counsel say what he would tell your law enforcement. What we would tell our codes is if they saw a group of people who are not socially distancing and they were clearly 50 or more, it's hard to count heads sometimes, they were clearly 50 or more, then they could issue a lawful order to disperse. And if it were ignored, they could call in law enforcement to enforce their lawful order.
Okay. So thank you, Madam Attorney. I appreciate that. 50 is a lot. I'm wondering if, and I'm thinking specifically game day sorts of gatherings, but not even that. I mean, I know house parties can, and when I say house parties, I'm talking about students. I know things can get out of hand pretty quickly. You know, it's not uncommon for that gathering of 5 or 6 people to all of a sudden be 50 people or 100 people. You know, we're texting and, hey, there's a come on over. And before you know it, there's a ton of people. So just for us all to think about, what's the right number? Is 50 the right number, commissioners? Or should we, the 10? Yeah, I mean, I think the 10 number was a better number for us, frankly, because it's more manageable. I mean, if I'm codes, if I'm a codes enforcement person and I drive by that party of 50 or 100, I know the right thing to do is to break it up, but that's a challenge. I mean, that's a difficult thing to do, because let's face it, that's not what people signed up to work for codes for. People signed up to work for codes for different things than breaking up a party of 50 or 100 people. That takes an entirely different level of training and a different level of resources than we have in codes enforcement right now. So those are things we need to think about. I don't have a motion to make in that regard, unfortunately, but it's a conversation that we need to have. And I want to get this on the fast track to a civil citation, so that there's some teeth behind it, and not just a, hey, would you please break up this party? And I would really like us to rethink that 50 number back down to 10. And I know that's inconvenient for folks, but we're trying to achieve an end here, and that end is to keep Gainesville and Alachua County, keep our community healthy. And we've been able to do that better than a lot of communities because we've been on top of this. So I'm not prepared for any kind of motion there, and I don't know what the motion would be, but let's have that discussion, and let's let that move around in our head a little bit. Dr. Lizardo, I'll wrap up here, but I've been reading about other forms of testing, the saliva testing that isn't a PCR process. Lord knows I'm not a scientist. I don't want to get too deep into the detail, but I'm reading about other seemingly very competent and useful forms of testing. Can you speak to those briefly?
Yeah, so again, without getting into a lot of detail, the answer is yes, we're pursuing other forms of testing. So that's really the heart of it. Saliva testing by itself is not a different technique. It's a different way to collect specimens.
Right.
You can do that from either deep nasal swab or just nostril swab or just saliva. The problem is validating it in that particular lab to meet the what's called cap and CLIA requirements for laboratory testing. So there's federal requirements in terms of quality control. And again, cap and CLIA are the certifying bodies. So once a lab has that validated and certified, then they can use that mechanism if they follow all the right rules and go forward. What the real innovation is with some of these other tests that we're looking at is that they don't tap into the national supply chain. So we're actually looking at that. I was actually just looking at my phone. I have a call today, I think at 1 o'clock, that's going to be looking at us kind of moving forward on different platforms and different ways to test. So we are looking at that. So we're looking at one that's called RT-LAMP and then RT-PCR, both using saliva. There's some stuff that's been put out open source. Again, we're just trying to figure out where and how do we coordinate that with other things, because still those tests have to be done in a cap and CLIA certified environment. So we're working with our pathology department, our hospital, and other private vendors as well. Just anything, leaving no stone unturned here to figure out where we can maybe expand our testing capability. So we're looking, we've got, like I said, good testing capability, but until I can test everybody on the planet every 2 weeks, I'm not going to be satisfied. So we'll keep looking and building that capacity.
Very good. Thank you, Mr. Mayor Pro Tem, Mr. Chair, and thanks everybody for letting me monopolize all this time. Thank you.
Thank you.
Thank you, Commissioner. Next, by no accident, Commissioner Hutchinson.
Thank you. Dr. Lizardo, is there science or evidence that large outdoor gatherings are sites of transmission? Because you said that you're interested in figuring out the places where transmission is happening. What's out there now in the literature in terms of are people catching this thing in large outdoor gatherings?
To the best of our knowledge, if they are physically distant and they're outdoors, the answer is, as best we can tell now with limited data, the answer is no. most of that transmission or spread is they're catching it indoors, and that's the vast majority of what's going on. Again, there's a long, colorful history with kind of how other infectious diseases were thought to be just from touch and from contact, and people said it's this, kind of, there is no such thing as aerosols, and that thought actually had stayed for not very long. And again, it seems like there's nothing new under the sun except the history you don't know. So it seems like we're reliving the history of other infectious diseases as we know that aerosols are more important. So again, I don't want to say that it doesn't happen outdoors because we don't have enough data. The theory is, and there's enough evidence to say that it's indoors and not out. Then it raises the question, what happens at big outdoor events? And in a town like Gainesville and any SEC town, you're going to be thinking football immediately. And so what are the risks associated with that? The answer is we don't know in terms, but we think that that risk is going to be substantially lower than it would be for any other similar indoor event or even something smaller on an indoor event. There's still the physical distancing thing and this, spit that can be spread, or what we call respiratory droplets that can be spread when we speak loudly or yell at a game. That's why masks at any indoor or outdoor event would still be recommended. But we're trying to collect that data and understand it as best we can. What's interesting is that what little data, and there's very little data remarkably in terms of large mass gatherings and infectious diseases, is that what is there does indicate that outdoors appears safer than you would think. And that's using mostly flu. We can't really use coronavirus because that really hasn't happened before, so there's no precedent. But based on what we know with flu, indoors is really the big culprit. In terms of being able to set policy, other than to say, if you're physically distanced and you're outdoors, you don't need to wear a mask, policy beyond that is really hard to establish. So what we say is that if you're near someone and can't physically distance, or you're going to be crowded, then you need to wear a mask outdoors. But otherwise, wearing a mask outdoors is not supported by the science. Just if you're walking, the Hawthorne Trail or riding your bike out there, or just walking in between buildings on campus, you can have your mask off as long as you're not going to be near anybody during that time. So we'd like to get more data. There are a lot of people working on that now. It's my understanding that there's a group in Germany that's looking at that very specifically, and we've got some research protocols that we're going to kick off here soon once we get some things checked. But outdoors appears to be safer.
Thank you. And then the other thing I'll just mention is in my chats with attorneys, which is going on right now, we could in our next emergency order have variable occupancy, like limit gatherings of 10 indoors and 50 outdoors or something like that. So that may be what we need to be looking at, particularly early on, just announce right up front for at least the next 2 weeks, this is going to be the rule, and then see how the compliance and other issues go with that. Because just saying 50 or 10, I think ignores the context. And I think if it's 50 outdoors or even more, that's less an issue than more than 10 indoors. So we'll work on language for that.
Yeah, and I think that's really reasonable. And I think that, again, getting back to that contact investigation idea, it's more than finding out who needs to be isolated and quarantined. It tells us where the spread occurs. So you try it, you see what happens. And then if there's spread, you pull back. And again, that's what we're doing with a lot of the different things that we do. So trying to find the right balance between, to be data driven. We know these things. And so take the next step and say, okay, this is a reasonable conclusion. Let's get data to prove that it's right or wrong, and then back off if the data shows that being data and science driven is kind of what I think our way forward, because there's so much we don't know. And just we need to keep building those building blocks of what is right and what will work.
Thank you. I'm done.
Thank you, Commissioner Hutchinson. Next in line, we have Commissioner Ken Cornell.
Thank you, Mr. Chair. Thank you, Dr. Lozardo. Thank you, Dr. Lane, for being here. It is not something that I take lightly, the fact that you all closed early and you're starting late. And I think the involvement with UF Health has not only helped our community, but I know helped many around the state. And so I appreciate that. There've been a lot of questions asked. I'm going to try to focus mine on just 3 quick areas. 1, are vulnerable. 2, are gatherings, what we just talked about, and 3, the school board. So the first question I have is really, what have we learned by watching some of the other universities over the last 2 weeks open up? What have we learned from the standpoint of keeping our most vulnerable frontline employees safe? those with existing conditions, and what policies have you put in place or are you contemplating putting in place going forward to really help protect our frontline employees and those that I think you mentioned, Dr. Lozardo, are most vulnerable?
Yeah.
Food service workers, janitors, so on and so forth.
Sure. I'll kind of speak to the more medical side of things, but there's obviously overlap between what both Charlie and I can answer, but he'll focus on some of the policy, but we'll obviously have some overlap. In terms of what we've learned in terms of other institutions, peer institutions, other universities, I think if you ask me right first blush is communication, right? We need to communicate. We need to do things like this right now, communicating with our community very clearly. And again, that this is not easy, right? You can't just consult Dr. Google and say, hey, what do I do here? So much of this is new and a lot of it is complicated. So our abilities to communicate complex, important information is key. So in other words, that idea about who's really at risk, the idea of what the numbers really mean, I think that's key. So there's no absolute number that says, hey, we got to stop. Well, it's like, where are those numbers? What's the context? What does the data show that's there, the evidence? In terms of the other things that I think we learned from the other universities is that I'm assuming, I don't know this, but what I'm assuming is that they probably overwhelmed their ability to be able to isolate and quarantine. They didn't have a good contact tracing team in place. They didn't have the ability to isolate and quarantine. So I suspect that kind of led to some of their things. And some of those had great health centers that, aspirational health centers, places that we want to be like and continue to grow as, but they probably, kind of got behind it to a certain extent. So I think those are some of the things that we learned in terms of protecting the vulnerable. I'll let Charlie speak to some of the policies, but I think that giving people the alternative work locations who do have risks is a key feature. I think we have enhanced masking that people can have. So normally those who may have risks who opt or are able to be face-to-face or might be at higher risk, they'll be wearing medical grade equipment and that will be made available to them as well. So Charlie's team has done a fantastic job making that available. They can even do what we call kind of half jokingly as suspenders and a belt. So when I go into a room with a patient with COVID in the hospital with very high levels of virus, I've got my face shield, my N95 mask, I've got gown and gloves, and I go in. People won't need gown and gloves in a natural setting, but they have that ability to kind of scale up and do other things if they would like to be able to limit that risk even further. So I think those things have all helped, but I'll let Charlie speak to some of the other policy things that we have in place. But I think it's a way to keep an eye to the vulnerable and also learn from what our peer institutions have gone through. But Charlie, anything to add policy-wise?
Mike actually stole a lot of my thunder, and I'm fine with that. Really.
Sorry.
But the truth is, Commissioner Cornell, I just start by saying, really, I want everybody to know this. I think our frontline employees in many ways are the heroes of the day. Our custodians, we have another number of employees who are constantly in contact with others, whether they're librarians or staff who have to work with students who may be coming in. I consider all these people frontline kind of employees or facilities workers. And really from day one, we have made it very clear that we do not want to put them in harm's way. As Mike said, we have bought all kinds of personal protective equipment, including N95 masks, KN95 masks, face shields, so that any of our faculty who are going to be in face-to-face settings feel as if, or if they may be at an age or have some other comorbidity factor, that we're taking that into account. So I can only say, Ken, that I just feel like we really have tried to look at this from every angle to make sure that those frontline employees are as safe as they possibly can be. I would also say too, Mike didn't mention this, but I know he has touched on it somewhat, and that is the science has changed quite a bit, or at least the whole topic has evolved over time. I know initially that we were very concerned, we still are, about contact of surfaces, but we've learned more that this is more of an airborne issue, as Mike said, than it was otherwise. And even in terms of air changes in a space, I mean, when we started this, we learned there was a positive COVID case, we would quarantine the space for 3 or 4 or 5 days. And now we've learned that really it just takes up to about 6 air changes to really make the space quite a bit more safe than it was. So, and we follow CDC guidelines from day one, Ken. So I really feel like we're staying in good touch with the science, as Mike has warned us and advised us. And I think it's paid off for us.
Well, I appreciate that, Dr. Lane. You know, we've talked since March that's been our number one concern, and I appreciate the attention and the consistent attention. I know you've made some of your sick policies more liberal, and you know, if you are sick, stay home, and so that's great. Moving to capacity, Dr. Luzardo. I know back in July we were having constant conversations with Mr. Myers, and we had talked about increasing the number of tracers that were available on campus. And I think back on July 14th, we were hoping to have UF have up to 30. Can you discuss kind of where you are on the hiring of those tracers and what that current capacity looks like?
Yeah, we currently have 28 tracers on service right now. So we've got 28, and then we're going to try to fill those last couple of positions. And that's enhanced by, I believe, the 15 that the county added on as well from their side. And we share responsibilities too. So when we kind of had a couple of slow patches there, we picked up a few for the county and we share back and forth. So I think that capacity has really expanded a lot, and we're in a good place. We also have additional folks. We have nurses, we have an infection preventionist. I, as a physician, they were actually going to add another physician part-time to kind of add to some of the site visits that we've been doing at the facilities around campus. So we've all together have a team of about 35 total right now, and then hopefully going to add, I think we got a little bit of budget left to add a few more of the tracers on there as well. So there's quite a few.
So we talked about hospital surge capacity. Do you feel like you've got enough surge capacity for those tracers? Because if you need more, you know, we ask every week, what can we do and how can we help you? If that's a place that you need help, please don't hesitate to ask. And I know you won't.
Yeah, we certainly will ask about that. I think right now, you know, there's a logistic issue in trying to bring that many people on board. And as I tell people a lot, it's actually, my wife says I had the worst examples, but I'm going to go with this one. But it's almost like trying to build the airplane while you're flying it.
Right.
And so we're recruiting while we need people and training and doing all these things simultaneously. So the county's been great. I mean, Paul has been just, again, it's a 20-year relationship that we've had with Paul and working with him in various capacities. So that made it a lot smoother and a lot easier. So it's been a really good place to be. But certainly if we need things, we'll let you know. There may be some things that come up. So that's super helpful.
Well, this community is relying on y'all building the airplane as it's flying. So thank you for continuing to do that. To speak to Hutch, your point, I'm in favor of the 10 inside short term and the 50 outside. I think, Dr. Lane, what I would say is, I think we can strengthen the order, but I think equally effective for the students is kind of your enforcement of their academic career. You know, I remember when I was on campus, I was pretty concerned if I had to go in front of, you know, student council or whatever the judges are there. And so whatever you can do on campus within the university, I think that will help our efforts, you know, more so than a ticket, more so than a citation. You know, if it's on their academic record that they're at a party that they shouldn't be at on or off campus, I think that is probably the most effective thing that I would ask that you look at, and maybe you've already done that. Lastly, moving on to the school board, Dr. Luzardo, you talked about spread, really identifying spread and where it starts. I know you are working, or you're part of the team, I believe, that's working with the school board. What are your concerns there, and what do we need to be thinking about as schools about to start next Monday?
Yeah, I think that, so part of the science medical advisory committee that works with Paul Myers and kind of following his lead on that from the health department. I think that my main thing is...
Are you on that committee or no?
What's that?
Are you on that committee?
I am. Yes, sir, I am. Yeah.
Okay.
Yes, sir, I am. And so with that, we've been advising about what the next steps would be and kind of the direction to go. So I think that the big concern there is that we don't really understand how infectious kids are. Again, it sounds crazy to say that, but there's not as much data. It's changing, and we're starting to understand that maybe they are, and that older kids, 10 and older, are probably behave more like adults in terms of their infectiousness, but kids under the age of 10, maybe not so much. There's some information from Europe where they did open up some schools that seems to support that idea that younger kids don't pose as big a risk. I think there is a plan that's in place in terms of what the triggers would be to close a classroom and then potentially close a school. Because again, getting back to my earlier comments, is that you want to know if you're spreading in that setting, right? So in other words, there's a lot of COVID that's in the community, and there's a lot of COVID throughout Florida. If those were contracted somewhere else or spread from somewhere else and someone caught it somewhere else and they bring it into the schools, but it doesn't spread in the schools, that's a different matter. But if we find that it is spreading in the classroom, and if there is evidence of spread there, and we do find that contacts do have a higher rate of what we call converting, in other words, they go from negative to positive during the contact period when they're in quarantine, then that's going to be a trigger. And so as a parent of an Alachua County public school student, I mean, this is very real to me as well, and just trying to see, and a daughter who we've chosen what would be best for her will be bricks and mortar. So this is going to be very relevant to us as well. So I think that lack of precedent, the lack of data is what concerns me the most. I think we've got a good plan moving forward and good people that are willing to just say, hey, this isn't working, this is what we need to do. I think that the rapid testing platforms that the health department is planning to put into place will be helpful, and the testing availability will also help that significantly. But again, I just wish I had a magic wand and can test everybody every 2 weeks on the planet and just kind of move forward with that. So,
well, I appreciate your comments, and I guess I'll conclude by saying that what you said earlier, I think, is the key for the next 2, 3, 4 weeks, and that is that we over communicate, that when we have tests or we have clusters, that we get that out immediately. I think the supervisor of elections was spot on when she, over communicated about the one event at a polling place. I think if the university, the school board, the county, the city will kind of over communicate, I think that will really, really help with everyone understanding that, we're not going to quit. We're going to work hard, and we're not going to be perfect, but we're going to do the best we can and continue to adjust. So I would ask that that you keep using your voice to tell all of us that we need to over communicate. Thank you. Thank you, Mr. Chairman.
Thank you. Thanks.
Thank you, Commissioner. Next, Commissioner Hayes Santos.
Thank you, Mayor Pro Tem. And thank you, University of Florida, Dr. Lane and Dr. Lizardo for being here and the presentations that you put forward. To the county chair's point on the kind of reducing the indoor capacity of private parties, I support that, and I hope that the county commission moves forward on that. I do have some questions for UF related to game days, where we'll have, in a normal game day, there are tens of thousands of people coming from all over the place, and even though it is outdoor, there's tons of interaction between people, even during tailgating and kind of areas around campus. What is your current stance on fans in the stadium, and also on tailgating on campus? And kind of also, do you have recommendations for helping to reduce, even on game days, people go to restaurants and stuff like that, and there is kind of more people out and about. I guess, what is your kind of current plans with that? And then also, what do you give recommendations as well for outside of campus?
Well, let me
Go ahead, Charlie, and then I'll comment on the medical side. You go ahead. So, Tom.
Yeah, Mike let me go first because he wants to make sure that I step in it before he does. So,
yeah.
It's a great question. I know everyone's interested in this, and we've had meetings with the city, the public safety officials, etc., on how we would plan to have a game. And I've had conversations with the AD. None of this is set in stone. Let me start by saying that. If we try to achieve some distancing in the stands, it looks as if we could get as many as, say, 15,000 people in the stands. Now, that obviously means we still have to make sure they get into the stands safely, the concessions are administered safely, etc. And there have been a lot of discussions about this. We're also taking our lead to some extent from what the SEC in general says they'd like to see us do. I don't know what variability they're going to allow within each of the stadiums. So I just want to make it clear right now, we don't have anything set in stone. We talked with the city about whether or not we would allow tailgating, and I think our preference might be that we not allow tailgating. But we also know that could impact the neighborhoods around the stadium, that people will congregate and could create problems in that regard. So we need to think this through a bit, but I can only assure you that we're giving it a lot of thought and want to make sure that whatever decisions we make, that the city has been involved in that and is aware of what our plans are at this point. Mike, did you want to chime in?
No, I think that's exactly what I was going to say, but also add that as we have since the very beginning, UF Health is working with UAA and kind of all the others that are involved, public safety, everyone on campus, to just try to, where there is science, we're applying it, and where there isn't, we're saying where we need to get more. So again, a lot of this is going to be apply what we know, see what others have learned, see what others are doing, and then test and see what we're doing. If it makes sense, test it. If it doesn't make sense, stay away from it. And so we're just kind of putting that together. So we've actually had people from our team go through the facility. They're going to be touring the facility here throughout the next couple of weeks and kind of figure out where pitfalls might be. So we're looking at all that and been working very closely with UAA and others to come up with the best advice that we can.
I should also comment that it's a range that we're looking at. We're looking at 0 people in the stands all the way up to. So it's not maybe either or. Okay.
Yeah, and I appreciate that. And I guess my concerns about having even some fans in the stadiums is just the environment that happens during a game. And I think even during that, more people may just come out just to be a part of that environment and not even go. And I've tailgated tons of times and not even gone to the game too. So that's just my concern is, well, we may be at the max 15,000 there. There's still maybe 2 or 3 times that more might be outside and just interacting and tailgating is moving around to a lot of different places and talking loudly to people in different places. So I feel like there's a somewhat of a chance of transmission. So I hope that we go on the lesser route. I do have one question in terms of consistency on the outdoor amount for kind of events and stuff like that. The University of Florida has, I think, a 250 max cap, and then Commissioner Hutchison, I think we are at or the county is at 50. And I'm wondering, I think it'd probably be good to have some consistency, or I guess bringing up that conversation of making sure that we have consistency between the University of Florida rules and rules that are outside into the government. So I just wanted to throw that out there for the chair and other ones to make sure we're consistent there.
We want to be in lockstep.
Yeah.
That's all I'm going to say.
Thank you very much. Thank you, Mayor Katem.
Thank you, Commissioner. Next, we have Commissioner Gail Johnson.
Thank you, Mayor Pro Tem. Thank you, for, Dr. Luzardo and Charlie for being here and all the really, really great questions you all asked. I think it's been very enlightening, not just for me, but for the people that are listening. I have a couple of questions. One, I want to say that I'm definitely in favor of strengthening the short term, the order, at least in the short term for the next few weeks, and see where we are after that. I have a couple of questions, one around schools and 2 around Gator Nationals. Schools, I understand that there are contact tracers that have either been hired or are being hired for the schools, the Alachua County Public School System. So I want to understand what that process is, kind of where we are with that. And 2, I'd like to get an understanding from City Manager Feldman and/or City Manager, County Manager Lieberman about either conversations or thoughts around Gator Nationals and how we are handling the influx of people that are going to be coming, I think on the same day, or at least same weekend as the first game day for UF football.
Paul Myers is on the call and he can answer the question about the contact tracers. Go ahead, Paul.
Hey, good morning, everybody. Thanks for having me. So the school board is in the process of recruiting 16 contact tracers for the schools, as well as the health department. As I communicated to the Board of County Commissioners yesterday, we're having some difficulty with recruiting the LPNs for the schools, but our fallback position, and again, we're faced with a plan B, and I think Dr. Luzardo had mentioned this before, that we continue to be nimble and adjust to the current conditions. We have contact tracers here at the health department. We also have a CDC forward team that's going to help us with the school issue on Monday. And so I don't have any concerns right now while we continue to recruit those positions.
Okay, so it sounds like there are people to step in the absence of the 14 people that you've hired or will need to be hired. Okay, thank you. Thank you. And then Gator Nationals?
Well, I'll defer to the county manager on that.
Well, we discussed that. I know the legal team is looking to see whether or not we are preempted from telling them they can't have their event because the state in the governor's order allows certain national sporting, basically took jurisdiction away if it's a national sporting event. And so because it's the NHRA, the National Hot Rod Association sanctioned event, we may or may not have the ability to regulate it. Michelle, did you have any further thoughts on that?
Mr. Chair, that's correct. This is a National Hot Rod Association event, and so we are looking into that, but it is very likely that we are preempted because the governor's orders does preempt the local jurisdictions from getting or interfering with professional sports. So we're looking at whether this falls under that definition. Our staff did call a few hotels yesterday, and there is currently no one that has booked a room for their pit crew or for Gator Nationals. So we're not sure whether or not it is moving forward because, as I said, there are no hotel rooms that we have found yet that were booked for the event. We are looking into it, as I said, on whether or not we have any ability to cancel the event or regulate it in any way. I know that when they were looking at coming here prior as all this was starting, we were coordinating with the health department on what could we do to message the public on important things such as social distancing and putting up signage, and the county was prepared to make that signage, and Gator Nationals at the time were more than willing to put up that signage at all entrances. So to the extent that we can't regulate them, they have been very cooperative in doing things like the messaging and putting up signage and whatever the health department has suggested as far as the ability to minimize any impact.
Thank you. I appreciate that update. Do we have any idea how many people usually come in town for Gator Nationals?
I can tell you that a person contacted me who has season tickets to Gator Nationals and said that in the communication from Gator Nationals, they said they would be limiting the attendance to 50% of a normal year. But I think a normal year, it's 50,000. So, you know, they'd be selling half as many tickets, I guess.
That's correct.
Wow.
It's about 50,000.
Wow. Okay. I appreciate the work that you all have been doing on this. And if you can just kind of keep in touch with us and the city manager about where you land on this, that would be helpful, I think, for all of us.
Thank you, Commissioner.
Thank you.
Next, Commissioner Gigi Simmons.
Thank you, Mayor Pro Tem. I just have one quick question. I noticed on your, this is for Dr. Charlie Lane, on the Florida football schedule, there's no homecoming. So would there be no homecoming parade this year?
I can't speak to that, Commissioner Simmons. That's a good question. I don't have the answer to that. I'm sorry.
Okay, that's fine. But once you find that out, can you let us know? I think that's going to be something we really need to address once you find out for certain if indeed you guys may have that homecoming parade and what that looks like.
Thank you.
Thank you. And one other thing, I love the idea Commissioner Hayes Santos brought up about being consistent, but the number of folks in a group where UF have the 250 limit, and we are looking at 50 limit in a group. I think we need to have some type of consistency, and I would love to have that conversation and to how we can come at a number, or at least just be consistent, because when you at University of Florida campus during game day and that crowd spills into the neighborhoods and spills over into the street, of course, initially it was 250, then it comes and people get congregate and may become more than 50 in a group. So I think we need to have at some point look at how we're going to manage that on those game days once they leave the campus and once it comes over into different areas of the communities. So I'm very interested in that conversation. Thank you.
Okay, I saw another hand go up for Commissioner Cornell.
Dr. Lozardo, thank you, Mr. Chair. Dr. Lozardo, do you agree with the 50 outside gathering and the 10 inside gathering for the next couple of weeks as a threshold?
Yeah, I think that's a very reasonable approach to just see what that does. I mean, I like that idea. It's, again, the numbers are somewhat arbitrary, but they make sense. And I think it seems like a reasonable approach.
Yeah, I thank you for that. I do too. So, Hutch, I know we've got David, I know we've got Paul Myers and the superintendent to give presentations. I guess when we're done with all that, so they don't have to sit through our motions, I'll certainly make that motion with Hutch.
Thank you.
And Mr. Chair, if I could point out, the superintendent has a 1 p.m. hard stop. We did not realize that this was going to take so long. We did put her on second to make sure she had time, but she does
realize it was a county and the city commission. Yeah, poor folks. Okay, well, she can go next, whatever.
Thank you, Commissioner. And yes, we were going to move into the discussion. I would ask that motions be made at the conclusion of these discussions so that we can both include the public, but also allow our professional guests and staffs to return to their very busy schedules. I will be very brief. Of course, thank you to our guests from the University of Florida. We always appreciate you coming here and informing not just government officials, but also the viewing public who have been watching these meetings since March. I will be very brief with my comments. I will try to not overlap, but I want to make sure that both my views are expressed and also that we can address some of the concerns that were made. First, let me say that I'm in full agreement that the restrictions for gathering should be 10 indoors and 50 outdoors for the next couple of weeks. These were original recommendations from the CDC back in March, and as was stated earlier, we have had a greater outbreak in the last month or two than we did in March here in Alachua County. So it only makes more sense to follow those guidelines. I think that there is a need to bring up the fact that the Rights Union is an early voting center, and I want to make sure that that does not get interrupted, but that we can safely have voters coming to that site without potentially putting people at risk. And I know that in-person voting is a concern for this election cycle. I am in full agreement that we should have a citation for individuals not following the gathering procedures and rules. The whole reason why our society has undergone this massive disruption is because this virus is very deadly. And so I think it is no small thing to punish via citation people who are not taking that deadliness seriously. And so I would ask that the County Commission take that lead in their emergency order to allow us to make that enforcement. And also to be very clear with our rules so that people can understand. One thing that I also like to say is that a lot of our questions today focused around specific details around transmission and how that may happen indoors or outdoors. And I think that the communication from the university and from the governments has been very effective in the rules that we want to impose. I think it would also be helpful to include a little bit more information with how we know it spreads. I have heard from a number of individuals what they think to be how the virus spreads, and that is simply not true. And so we need to make sure that we're constantly educating people about how the virus actually spreads, because there seems to be this false notion that if you're around someone who has COVID-19, that there's no way around it, you've already got it, which we know is not true. We know that there is specific ways that it is transmitted. So I will say regarding the SEC and regarding football, the commissioner made this point earlier about people's behavior. And, what we know about human behavior is that a lot of it is driven by expectation. And if people expect to enter the stands, people expect there to be admittance and concessions and tailgating, then more and more people are going to come and potentially drive up the risk. The SEC is going to go forward, it seems. And so I think that it's important for us to set expectations. I don't know how much control you all have over those rules or how much is set by the conference. But I think it is going to be very important that we set very low expectations for gathering at these football games. For example, the Gator Walk, I don't see how the Gator Walk can happen with all the football players being exposed to cheering fans yelling at them. I don't think we can do that. So these are the things that need to be considered going forward. I would like to close by just thanking everyone for their patience in my conduction of this meeting. I bring less than a fifth of experience as the man who normally runs these meetings, so I appreciate y'all's patience with me. So thank you very much. Dr. Lane, Dr. Lizardo, we will allow you all to go. If you have any final thoughts, now's the time.
Commissioner Ariel, I did not mention Gator Walk, but in the discussions I've been in, it's clear, as you pointed out, that we likely would not have that. Okay. Again, I'm not speaking for Scott Strickland here. I want to make that clear, but still a work in progress. But trust me, we're looking at everything the commission is, both sets of commissioners have pointed out. So thank you for your time today.
Thank you.
Mike.
I do have one last question before you all leave. Thank you. I wanted to find out what kind of coordination there's going to be between the health department and UF and the school board with contact tracing.
Mike.
Yeah, so I think, so obviously Paul can answer that as well, but we work very closely together with them as it is now. We share resources. We meet every Thursday to go over case, kind of what the issues are. Paul is, as the director of the health department, is essentially in charge of our overall efforts. So we report to him what we're seeing and offer help if there's places where they need help. And likewise, they offer us help as well. So I think there will be coordination with that. My understanding is also that we're assisting with the training of those contact tracers when they come on board, because it's a skill that requires some training. So we've been assisting with that. So we've been working together on that as moving forward. And as the needs come up, we'll continue to coordinate. I don't know, Paul, if you have something else you want to add to that.
How much of that information will be public, or how much will there be a dashboard? Because so much kind of overlaps in our community. Like, I'm just interested in the public aspect of that.
Okay.
Yeah, so Commissioner Johnson, great question. And in addition to the training that Dr. Lizardo just mentioned, 28 contact tracers that are essentially Department of Health personnel embedded at the University of Florida that assist us with a large part of our community. You know, the University of Florida is the second largest city in Alachua County. When it comes to the school board, Dr. Lizardo and the other 5 members of the Scientific Medical Advisory Committee have been instrumental in putting together the metrics that the school board is considering in terms of metrics that are actionable, how we respond to a positive case or case in the school. In terms of public information, I'll defer to the superintendent, but I do know that the plan is to be as transparent as possible when we do have a positive case or cases in the school.
Thank you.
Thank you.
Thank you, Commissioner. All right, thank you. And thank you very much, and stay the course.
Thank you.
Yes, thank you very much. Thank you.
Very well. Next, we will welcome our next guest, Superintendent Karen Clark. Thank you for being with us today. We will try to proceed this in a similar fashion. Commissioners will allow the superintendent to give her updates. If something is so urgent that you must speak, please get my attention through video. But in any event, I'd like to proceed in the same manner to allow the presentation to finish, and then we can move into question and deliberation. Superintendent Clark, you have the floor. Thank you.
Thank you, Mr. Chair. I appreciate the opportunity this morning, and even the notes that I had written down for myself of information I wanted to share today with Dr. Lane and Dr. Lizardo, with some of their information. Some of that certainly overlaps, but it also has given me some other things that I want to share with you today. First, as most of you know, we are on track to start school on Monday, the 31st. We are one of the last 10 districts in the state, based on my count from the Superintendent's Association, to start school. So a good chunk of schools started this past Monday, the 24th, but we will be one of the last few districts to start, but that's okay. That's given us some time to look at some other districts. I know there's been some reports of, cases in different districts and how those are being handled. And I've had pretty significant conversations with numerous superintendents across the state of how they are handling these things as they have arisen. So that definitely has given us some time. As many of you are also aware, the Department of Education is involved in lawsuit limbo with the Florida Education Association. And so there's been some decisions made this week. But at this point, we are still in limbo. There was a decision that favored the FEA lawsuit, and then an appeal was filed. And so, things could still change before Friday, but we are moving ahead as if we are opening on Monday. But then, of course, we will comply with whatever legal rulings happen between now and then, or even after that time, because, the way the legal system works, it could take longer. And then obviously we would need to respond accordingly. With that in mind, as we're looking at the number of students who will be in our actual schools, starting on Monday, we're looking at the bulk of our schools being at 50% capacity or less. There are two, Newberry Elementary and Santa Fe High School are edging close to 60%, but most of them are at 50%, and some are down as low as a third of students who will be reporting back to campus. And that's okay. That is okay. When we've got less students reporting to campus, certainly that helps us in those large group times, such as lunch. That gives us more room to spread out. Our schools have also created plans to expand that. So they've had plans for overflow seating, using those outdoor areas, things of that sort. So with fewer students, it gives us some more flexibility in how we're using our buildings during the day to be able to maximize and use our largest spaces. Some of our classrooms are smaller than others, so we don't have to use those smaller classrooms right now. We can use bigger classrooms. So that reduced attendance will give us the ability to do that. The reduced attendance has also given us the ability that on our bus routes, we will be at less than 50% capacity. There's still a handful of routes that are kind of giving them some trickiness to work out. But with over 400 unique runs on our buses, 99% of them at this point are below 50% capacity, and many of them have 10 or fewer students on them right now. So the transportation department has done an excellent job of basically rerouting the district to be able to make that happen. So, but of course, as students start returning to school, things will look a little bit different, but we don't know when that is. We have asked our parents to make a 9-week commitment because that gives us the ability to plan that. But I will say, even up until this morning, we still have parents whose situations are changing, that they're shifting. And so while we've got schedules completed, we've had schools that have had to completely reschedule, and scheduling a school is no easy feat. And so that has taken quite a bit of time, especially the secondary level. That's a little more tricky just because of the number of courses you have during the day. Elementary is not as impacted, but there's still a lot of moving parts right now as it comes to schedules. And obviously when the students actually report, there may be some students that report that we didn't think were coming to school, and vice versa, that we planned for them to attend, and instead they're going to choose to shift to a different model. Part of this process, obviously bringing students back into the building, are the safety precautions that we're going to be taking. We do have a mandatory mask policy. It mirrors the county ordinance. So that will be in place for all of our students. We've got, there is a medical exemption form that there may be cases where it's problematic or a health issue. But the only way we're going to allow that is with a signed off from the child's physician to be able to allow for that. But we will be screening daily. So there's screening daily protocols for our employees and students, temperature checks for every student. We've got 2,500 thermometers. So our children are going to have their temperatures taken every morning. And then those that participate in our after school programming, which is predominantly at the elementary level with our extended day program, they're also going to have their temperature taken at that time as well. We do have scenarios where students might have low-grade fevers, and if you get just enough Tylenol in them in the mornings at 7:30, it can last a good chunk of the day. So we want to make sure that we're taking those in the afternoons as well. So we've got that ability. And then we've also designated an isolation room at each school. So if a student does present with any type of symptom, a fever, a headache, whatever that symptom happens to be, there will be that particular area at the school where we would try to isolate that student away from other students. Where this will go when we talk about symptoms, and as was mentioned earlier in the meeting, if folks are sick, stay home, whether that's a student or an employee, that if you're having symptoms, please stay home. Parents may be getting more phone calls than they would have in the past to come and pick up their child from school. So obviously that may present concerns for our local employers of, that the school's calling to come pick up my child because she's got a fever today. And we want the parent to get there as quickly as possible. So that may present a challenge for our workforce, because when we will be calling, it's because the child has presented with some type of symptom. The health techs were mentioned earlier as part of the conversation. We do have a nurse in place at every school to start school on Monday. So there will be a nurse in place. The health techs will be there to support our nurses, help us with that isolation room, assist with the contact tracing. So that will be an additional level of support. But even though those folks are not hired, we've got a plan B in place where we do have the nurses at every school, but then also a health department team that will be assisting with testing and also with tracing as we start the school year. A big piece of this is also going to be how we identify those students as part of contact tracing. If you're 5, it's going to be really hard to remember who was I in close contact with for 15 minutes. That's not something that's going to be really easy. But likewise for the older students and even staff members, sometimes you forget who you were in contact with. Seating charts are going to be very critical for us this year, where teachers and bus drivers will have seating charts of where those students were, which will help us in that contact tracing. So even though a high school teacher may allow students to sit where they want to sit on day one, that will be their assigned seat, so that we're going to be able to identify those students who are in closer contact with students within their classrooms. So that's something that we've been working with our school principals on and our transportation department to make sure that we have that in place to assist in our contact tracing efforts. It was also mentioned by Dr. Lizardo, who we are very fortunate. I talk to superintendents more regularly now probably than ever before, and there are many districts that do not have the resource that we have with UF Health and these medical professionals who've been working with us since day one. And I cannot express my appreciation to them and Paul Myers enough as they guide us through this process, because the school district is not a medical professional. We're in the school business. We're not in the doctor business, so to speak. So their work and their collaboration with us is very key to moving forward through this process. The SMAC committee has established some parameters for us to consider as we look at closing facilities, whether that's the closure of a classroom, closure of an entire school, or the closure of the district. But what I will also say is, if we get to those parameters, that's not necessarily that absolutely happens there. Those decisions will be made in collaboration with the SMAC committee, because every situation may be different. How the spread happens may be different. The testing process may look a little different depending on the scenario. So those metrics are going to be the parameters we're working within to guide those decisions. But those decisions are going to be made in consultation with that SMAC committee as well, because I want to make sure that we have the best possible data in front of us, because as we all know, the data and information has changed since March until now. We've made multiple changes in different protocols that we thought we were going to implement when we closed out last school year. And then things have changed a little bit over time based on new recommendations from CDC, new data, et cetera. The other piece that was discussed was a dashboard. We are working through that process right now. We will have that active next week when we start school of what that looks like. And so what we're looking at some different models of how to report that data, because obviously that we want to make sure that people have the information, but in the easiest to understand format. So at a quick glance, a parent or a community member would be able to see that, but that will be in place beginning next week. It is important also to note that the Department of Education is going to be tracking what's going on in our districts as well. So when we have cases, we now have to report those to the Department of Education. They have instructed us that they want us to be surgical and not sweeping. That's been kind of the buzz phrase that they've used with us the last couple of meetings as to how we handle COVID situations, which is fine. But here in Alachua County, we're going to handle those cases in conjunction with our local health department and with our Scientific Medical Advisory Council. That's how we're going to operate to make sure that we are using the resources that we have in front of us. A couple of other pieces. We do have a COVID page, a return to school page on our website, which is basically our clearinghouse or our resource page for anything COVID, reopening schools, reopening plans, all of that information we're housing on one place on our website, which will, anybody that wants any information about the school district and COVID, it is right there. And we continue to build that page. We have an FAQ page for parents. And even as those answers have changed or been revised over time, we're continuing to update that page for families to make sure that they have that information. We also recognize the social and emotional impact that this has had on our families, our students, but also our staff members. So we have actually are starting a wellness support group for employees that will start next week with some of our community partners to be able to give our staff the opportunity to receive some of that assistance. We also have our employee assistance program. If folks feel like they need more significant counseling or assistance there, it will be in place. But we've also provided additional social and emotional training to all of our teachers as part of this work with our guidance counselors, recognizing symptoms in students, things to look for to be able to refer those students for additional support if necessary. So that's a piece that I feel very strongly about because there's many things that we don't know. There's things that we don't know. We haven't seen our kids in almost 6 months. So how has this impacted their family? And how are we able to better support our students? So that's a big piece of it as well, not just getting them back to school for academics, but what are those other social, emotional wellness pieces that we need to take a look at? Some of the other things that we have to think about, obviously the supply chain, Dr. Lane mentioned that as well for UF. We feel like we're in a very good position. We started ordering items back in March, recognizing that moving towards a school reopening, whatever that looked like, that every other district in the nation would be ordering the same things we are. So even ordering things in March, there are some things that just arrived last week, some things that are arriving today. But we've been able to pull that together because we don't operate a big warehouse and a big logistics department within the school district. We've decentralized that so much, but we've been able to pull a team together to get that information to our schools and get those supplies out. We've spent over $1 million on PPE and additional cleaning things and supplies for our schools, and we'll continue to order those as we need them. But we have plenty of masks, both that we've purchased, but also some that have come through emergency management from the state to the county, then to us, both cloth masks, but also disposable masks, face shields, you name it. We've got face coverings. But then also looking at our supplies of hand sanitizer. We've got hand sanitizer dispensers in every classroom that are being installed now. We ordered 2,500 that are being installed district-wide. Most of that is finished. And then the bags of the sanitizer itself actually are arriving today. So those will be installed tomorrow and we will be good to go. Our computers have arrived. We were getting a little nervous about that because everyone in the country is ordering all kinds of technology. But we spent $3.5 million of our $1 million funding, which funds classroom technology on laptops. and iPads over the last 5 months for our students, and they are being imaged and programmed to do what we need for them to do for our students who are going to do distance learning. And so those are being programmed as we speak and distributed to the schools. So as schools request those, we have a centralized place for that. So as schools need those to distribute to families, we're able to provide those. And that also goes along with internet service. And so we've got a couple of options for internet service that we're providing for our families. Cox Communications has worked really well with us this summer. So the families that had requested internet access as a result of their surveys, we were able to send those addresses to Cox, and they were able to identify for us which ones were not in their service area. And so that's when we moved into hotspots, and we've got all the Verizon, T-Mobile, AT&T, the various providers, so we can provide the best possible option for internet, because as we know, sometimes Verizon doesn't work in one area and AT&T is better. So we've been able to secure that for our families as well. So that is all being distributed as we speak to those families who need that. So some of the things we're still considering, obviously the supply chain, we're going to continue to order, but also those gathering and events for us. Meet the Teacher looks very different this year. Some of that's being done virtually, some of that is being done on campuses, but we've really tried to restrict that to those students who are in the transition grades, like our kindergarten students coming to school for the first time, and that's being done by appointment at schools or in very small groups, 6th graders, 9th graders, those that are transition or those that are brand new to a school. We've really tried to restrict that. Obviously, our open house is going to look very different this year, but that's going to be probably not for another month to 5 weeks. So we're trying to push that out and kind of see how things go and how we can make that more user-friendly, but how do we handle those events moving forward? You know, high school sports, clubs, all of those things we're working towards being able to, how can we offer those things in a safe environment for our students? So there's lots of moving parts as we move forward. I believe it was Commissioner Simmons that asked about homecoming, and that is something that for us this year, because we have had to adjust the calendar, that is not going to be a holiday for our students this year. So even if there is a parade, now granted, I would assume we might have a high absence rate that day if there was still a homecoming parade, but we will have school that day. So I've got a note to myself that I will reach out to Dr. Lane on that, because we will still need to run school buses, and that might be in the middle of a parade time. So I obviously will need to address that because we've had to make some adjustments to the calendar, so we aren't going to school still in July next year. So, you know, moving forward, I would say from a community standpoint, city and the county, again, I go back to making sure that we're keeping our children at home if they're ill, and that's something that is going to require, you know, some support and some grace from our local employers. You know, if we're trying to make sure that we are keeping our sick students home, then that's going to obviously involve the workforce, and so that's something as best that we can do. We reached out to the chamber as well on that of how can we support our families to keep our students who are ill or exhibiting symptoms at home, or if they do need to quarantine. That's probably the biggest piece right now to make sure that we're keeping our students safe and our staff safe, those that are coming back and are physically present. We've got a number of teachers who are working remotely. Our focus has been those that are over 65, those with underlying health conditions, as much as possible, making sure that they're able to teach remotely. And if they can't teach from home, then they're teaching from their classroom, but no one else is in the classroom, and they can get in through a back door and not be able and be able to have an environment where they're not in contact with others. And so that's going to be key, is those who are coming in contact with our students and staff, making sure that we're keeping those at home. Making sure that if a child has had a COVID test and still doesn't have the results yet, even if they're feeling fine, making sure that they don't come to school on Monday. Some of the districts in Georgia that had cases on day one, well, if they came to school with COVID on day one, they obviously had it before they came to school. So if we've got any students or staff members that are pending a COVID test result, we want to make sure that those students are not coming to school on the first day. We don't want to get a call at midday that all of a sudden we've got to shut a classroom down because of a COVID case that happened, you know, previously. But to close my comment portion, recognizing there will be questions. We've had incredible collaboration with UF Health, with the health department, with UF building some of our instructional technology pieces, being able to create a scenario for our students to be able to reopen. That yes, there are 67 school districts plus the lab schools, but we also know that each of those school districts are very unique and what the needs are and what the support levels are within their community. And so we are just very fortunate to have that, fortunate to have the support of the city and the county moving forward, because it is going to take all of us collaborating together as we move forward to make sure that our community is safe. And that's a big piece of that, is making sure that our K-20 system is safe as well. Obviously, my part in that is K-12, but we want to make sure that we keep our students and staff as safe as possible, which will in turn impact the community's well-being as well. So, Mr. Chair, I'll close my comments for now and turn it back over to you.
Thank you, Superintendent. We will move now with comments and questions from commissioners. Commissioner Gigi Simmons.
Mayor Pro Tem, I believe that was an old hand.
Oh, all right. Thank you.
I'm sorry.
Nope, no apologies. Commissioner Ken Cornell.
Thank you, Mr. Chair. Thank you, Superintendent Clark, for being here and participating in this joint meeting. It's really, really important. Dr. Luzardo talked about the importance of over communicating. I was glad to hear you're working on the dashboard. I thought that was a great recommendation that came in from one of our active citizens. So I appreciate you kind of leaning in on that. How exactly will you be communicating? What's the process that you will be communicating when you have a case to both your staff and the parents and the community?
Sure. So if there's a case or an exposure situation or a case on campus, what we've done, what our communications team has done, is we've established a template so that what that messaging look like is going to be consistent, whether your child is at Eastside, at Norton, at Newberry, at the district office. That communication will be similar. So we've got several different templates to use, whether there's been a COVID case in a classroom, whether it's in a school, whether it's been some exposure. So those letters will go home immediately. So as soon as we are aware, obviously though, our first concern is that contact tracing. Who's been in the close contact? Who meets that close contact definition? That's who we need to speak with first, right? So we want to make sure that we are identifying and isolating that group of individuals first. But at some point then that day, of course, depending on what time of day we get that information, then we would be sending that information out. And it may be, especially at a large high school like at Buchholz, if we have a 9th grade student in one class that tests positive, there might be 12th graders at that school that don't even know who that child is, has never come in contact, never even crossed paths with that student. But we are still going to send that information to the entire school. And basically that notification says that, we've identified those who are in close contact, but here's also this information. So even though it may be over communication, but we want to make sure they have that information.
Is it in a written format, email, using your text? Like what's the actual medium?
Right. So really there's the Sky Alert system, which we use with email and text, will go home. So even families that don't necessarily have internet at home, there's a big chunk of them then that also have the text availability on their phones. Similar information. Sometimes it's hard to read an attachment on the phone, but we can send it through that's called our Sky Alert system. Where we can send that information as well.
Will you be identifying the classroom or the school or I know you're not going to say the name of the individual, but like how will people know, okay, my kid was potentially close to them if they weren't, because obviously they're going to be contact traced by the health department, right, but I'm talking about other folks as far as how will they know that?
Right. So if my child is in 4th grade at Glen Springs Elementary School and it's in my classroom, then obviously that letter is going to look a little bit different. So if I'm a parent or my child is not in that grade, not in contact, that letter says, that there's been a case at your child's school. The appropriate individuals, have been notified that are in close contact. So there's kind of a two-phased approach here. One for those that are in that class or in that quad area, whatever it looks like, but then also one for the entire school
Okay.
or
and
the
then
entire work
staff-
site, whichever.
Staff will also be notified in the school.
Yes,
and
absolutely.
bus
The bus
driver.
driver, yes, if there's transportation. So if the child is at a school and we find out that Karen Clark has tested positive for COVID, but Karen Clark also rides bus 1, 2, 3, 4, we also, transportation is also in that notification chain so that that bus driver can be informed as well as the students on that bus can be informed, because there are scenarios where we restrict the way the routes are going. Generally, it's by one school, but there are a few cases where you've got students from more than one school on a bus. And so that's important as well. So they're a part of that notification chain here also at the district. So it's not just the school, it's also those in.
Who does the responsibility lie with regards to the communication? Is it the teacher, the principal, or is it your PIO staff?
Right. So if it's happening at a school like that, wherever the work site resides, so the work site supervisor, so it would be a principal at a school or the supervisor, they ultimately will be the ones notifying their staff members and their parents of those cases.
Okay, and then your administrative staff will notify the community.
Correct. Correct.
Okay. Is the school board following the county's emergency order as far as the guidelines?
For which things specifically?
Well, I know the school district and the university, they don't have to follow the county's emergency order. Have you all taken a policy that you're following it, or are you not?
Well, for the most part, we try to.
What are the differences?
Right. So I think a lot of it, we do try to follow in lockstep, just from the standpoint of confusion in the community and communication. So for the most part, yes, we are trying to follow those types of orders. But again, I think there's some scenarios where we might have to have those discussions with staff, with county staff or city staff, depending on what the scenario is.
Okay, so can you think of any differences where you may not follow the order? Like inside guidelines or CDC guidelines? Are there any differences that you're like, we can't do that?
Right. Well, obviously indoor scenarios of 10 people, I don't know that we can do that. And probably we won't be able to do that. Now I do have some classes right now where there are 7 or 8 students in the classroom. But there are others where I have more than 10, or a cafeteria scenario where we can try to socially distance them. And I mentioned the overflow rooms and overflow areas, which schools are going to be using to try to split that up. Schools not being built for social distancing. Schools were built to engage and to be close together. So where possible, we are doing that. So we are working to maximize what we are able to do, and what is feasible and what is practical for us to be able to do. So there may be some scenarios where we can't necessarily follow that to the letter, but knowing that we are trying to reduce it as much as possible, or to comply with that as much as possible.
So do you agree with Dr. Luzardo's kind of opinion that he expressed earlier today, that over the next 2 to 3 to 4 weeks, and I think we're going to add this to our order later today, that inside gatherings of not more than 10 are critically important?
Well, again, the concern being, I don't know that every one of our classes, I could not right now, based on current staffing levels, create a scenario where every indoor gathering was 10 or fewer. There's no practical way to be able to do that.
How are you keeping those classrooms safe?
The masks, social distancing as much as possible. We've also purchased plexiglass shields for our classrooms. So those are on the desk or tables in those classrooms as well. Depending on the building, we've got different air filters that go in the air conditioning units. Part of our contract, it's not just the type of filter, but it's also the type of coating they put on that filter, which adds another layer. And some of our an antimicrobial type coating on that as well. So it's not just the filter, there's that additional piece. But then also in some of our older buildings, they have purchased a bio ionizer type device that goes on those units to be able to ionize that air as well. So we've got that in place. But again, I think as following to the T, I don't know that we can do that, but everything that is certainly feasible for us to be able to do, we are doing. But I also mentioned earlier, looking at even the larger classrooms. So for example, the TA classrooms, the teaching auditorium classrooms at Gainesville High School are pretty small, but there are other classrooms that are bigger. So at least for right now, there may be the ability to relocate classrooms. You know, we've got band classes that are going to be meeting in the auditorium. Those have a capacity of, 500, 600, 700 students. Your band class might have 50. So you can spread those students way out and enable that social distancing. So a lot of it is really looking at what the facilities we do have and how do we utilize those facilities to create the best possible scenario we can for our staff and students.
Yeah, I think being nimble and continuing to look at the data is going to be critically important. I mean, we heard just not even an hour ago that we are continuing to learn that most of the spread, we think, from what Dr. Luzardo said, is airborne. And to have classrooms that don't have good airflow, that don't have good ventilation, that kids are sitting in for clearly more than 15 minutes at a time, I think that's something that I would ask that you talk to the Scientific Medical Advisory Council on how we can do that, especially if they think that we should have less than 10 people inside, and certainly our emergency order is going to say that. Let me move on. With regards to the closure of classrooms and schools, who makes that call? Is that the principal? Is that you, the superintendent? I heard you say you're going to be consulting. Who is the actual decision maker?
Well, ultimately, that accountability, I think, has to reside with me as the superintendent. Certainly, I would want to have a discussion with the principal at the building level, but I think the collaboration, the consultation with that scientific medical board is also critical. So any decision that I would make to do that, to close a classroom or to close a school, I would be consulting with them first, to have a conversation of what that looks like.
Or to not close a classroom or to not close a school. That would also
absolutely. So those conversations need to be had because, again, they are the medical experts. I'm not a medical expert. So I want to make sure that I have clear information from them prior to making that decision.
Yeah, and I guess I hear that. And I guess I want to make sure that we have clear responsibility laid out. When I asked that question to Mr. Myers yesterday, he said it resided with the school board and the district. And so they will be advising, but ultimately that decision rests with you and your board. And so I just wanted to make sure that everyone's aware of that. I guess the last thing I'll say is we've got CARES Act funding, and have you thought about what additional resources the school board may need moving forward as we're thinking about additional things that we need to do to keep both our staff, your staff, the kids, and the teachers safe? Have you thought about any additional resources you may need?
Right. And first, let me just say publicly, thank you very much for that initial support from us for additional training time for our teachers. But we have actually had some staff discussions about that. And I have asked our health services department, our finance department to work together to take a look at that, of what that might involve, and to make a formal request at some point. I'm not prepared to say exactly what that would be right now. But as I mentioned at the beginning, we've already spent $1 million on PPE. Even at 50%, even if 50% of our students come back to a brick and mortar scenario, you're looking at 13 to 14,000 students who are, if all 13,000 of them need a mask every day, I could go through 100,000 masks in a 10-day time period. So there may be things of that sort that we may need to look for some additional support in that arena. But we have actually started to have those internal discussions of what does that look like, and then we would be prepared to make a formal request.
We'll circle this date. September 8th is the date that the county will be having our initial conversation with regards to what the data looks like for funds being dispersed for individuals and for small businesses, and additional needs that the community might need. And if we need to reallocate some things, that's going to be our first conversation, and the manager will be bringing forward recommendations. If there are things that you find out in the first week, next week, I would just ask that you stay close in touch with our manager and obviously the city, so that we can be quick and nimble with those requests, and we can consider those, because we've given direction that we want to look at that every 2 weeks, but the first one that we're going to look at is September 8th. And I would just ask that you think about that and talk to your staff. So thank you,
Well,
Mr. Chair.
Thank you.
And Mr. Chair, that September 1st, we're actually having a special meeting to discuss that.
Oh, I apologize. Okay. Well, you might not have enough data by then, but certainly 2 weeks after that, we'll probably talk about it again. So thank you.
That first week will give us a good indication of kind of where we need to go. And flexible and responsive are our words right now. So we've got to be flexible and responsive.
Thank you, Commissioner. Next, Commissioner Harvey Ward.
Thank you, Mr. Mayor Pro Tem. Ms. Clark, thank you for being here with us today. I appreciate everything you all are doing. I want to backtrack to something I confirmed over the last few minutes from the previous discussion with UF folks, just for everybody's awareness. Homecoming's not happening. There's not going to be a homecoming parade. The UF Faculty Senate had a conversation yesterday about that, and that appeared to have already been decided. So Blue Key is doing virtual events and stuff like that all through October, and the staff off date is in the process of being moved, is my understanding. All the syllabi are being rewritten as we speak, and that's not an Alachua County Schools thing, that's a UF thing, but there's no homecoming parade, so be aware of that, everybody.
Good to know. Okay.
At least UF isn't going to have one, so
right.
So let me go back and say that to you, Ms. Clark, that my household receives a lot of communication from Alachua County Schools. We've got kids at all 3 levels of school, and I have been very pleased with the communication from all 3 of those schools. Very pleased, and that some of that is at the teacher level, some of it is at the principal level. A lot of it comes directly from Alachua County Schools. So that's happening. And I will also say that I can't imagine the logistical nightmare that not only regular school, if none of this was happening, there's a reason I didn't run for school board. It is a logistical feat to pull this off in a good year. But to do dual systems of schooling, dual delivery of education, I don't know how you can do it. There are going to be places that it falls apart. There just have to be, because you don't have the staff. I mean, you don't have the staff and the infrastructure. We as a community do not have the infrastructure for everybody to effectively learn at home. We don't. And most kids, in theory, are going to be learning at home. So I don't know how it all works. My hat is off to Alachua County teachers and support staff and principals and administrators. I don't know how this gets put together. And that's the same for every school district across America. Particularly here in Florida, where I don't feel like we have very good support from the Department of Education, from the Commissioner of Education, for the governor. So much is up in the air, but I want you to know that you and your staff from your office all the way down to every single person who works for Alachua County Schools, I'm so appreciative that you're making the effort. I am not going to be surprised at breakdowns in the process, because I just don't know how it happens. I will tell you, we haven't figured out at our house exactly how we're going to do the delivery of education remotely. We've got a good broad idea of it, but I think, like most parents, I'm not entirely sure how this is going to work at this point until it starts working. I know that the teachers have done everything they can to be prepared, as have the principals, but I'm willing to cut a whole lot of slack, because I just don't see how all this works. And I would love if you could promise that there would be no more than 10 kids in a classroom, but I don't know how you can do it. I just logistically, I don't see how that works. And this is a wake-up call to us as policymakers that buildings age, infrastructure ages. And right now we have a bright light shining on aging infrastructure, especially when it comes to HVAC systems and that sort of thing. But that's true of every one of our buildings. If a building is 20 years old, it's got issues that need to be taken care of. And we don't, not just us as city and county commissioners or school board members, et cetera, but across the nation, we don't take our built infrastructure very seriously until something falls apart. So that ought to be a reminder to all of us. I've gone on too long. I appreciate what you're doing. And, the communication thus far to me as a parent, as a generic parent in this system, has been outstanding. So thank you.
Thank you, Commissioner Harvey Ward. Commissioner Gigi Simmons.
Hi, thank you, Dr. Clark, for joining us. And I'm sorry, you all, I want to apologize. I'm having technical difficulties. So I'm actually holding this with my iPhone. So I don't know how this is going to work for a long period of time. So bear with me. I do have a question for Dr. Clark. Dr. Clark, and I may have missed this information, but have we discussed youth athletic programs, fall football programs, what that looks like, and do we have anything in place? Have we discussed that?
We have not discussed that specifically. We're still working through that right now. The Florida High School FHSAA voted to move forward with fall sports. But what that looks like could look very different depending on the school district. Our sports teams, the fall sports teams, have been conditioning all summer. So they had not been allowed to, suit up with pads and whatnot. But they had been conditioning all summer. August 24th was the first day of fall practice, which that's an FHSAA hard start date for schools. We're not allowed to start before that. Schools are working with other districts. We've got some districts that are not traveling at all and are only playing within their county. Some they've opened it wide up. Some are not playing sports at all. South Florida is delayed just because of the level of where the virus is in those communities right now. So we have not finalized any of that as of yet. But we're working on some preliminary plans at the point that we could do that, which would include mask wearing by the spectators. Even though it would be an outdoor event, we would require masks, require temperature screenings coming in, and an extremely reduced capacity. Again, if we were to start at that time, reduced capacity of a 25% or less of the venue, whatever that venue happens to be, whether that's a gym for volleyball or a field for football, something like that. But we're still working through that process. In many cases, the number of home games, so to speak, are greatly reduced. So some schools, if they wanted to play, would have to travel to another community. So there's a lot of moving parts still with that. The first games would have already potentially started. So those have not started as of yet. So we're still working through that process right now of what that looks like.
And how involved is the school board with that process, or is it just the state, the FHSA organization? How deeply involved is the school with that?
Right. So the board policy right now basically says that we will comply with the FHSAA rulings, guidance, policies, whatever theirs are. So there is policy language that speaks to that. Now, if the board wanted to say we are not going to do X, Y, or Z as part of that, certainly they could do that. But there's some policy language in there as well, so it gets a little complicated. But again, we're making some plans that if we are able to do sports, and again, there's a long time before that happens. Practice just started Monday, but there's still time between now and when a first game could potentially be, that a lot of things can happen in that meantime as well. So our goal is to just make plans of what that could look like. Obviously, there's discussions that would need to happen because Citizens Field is a part of that process. But again, that's something we still have to work through.
Okay, and currently there's no schedule set for fall sports in place right now?
They all are working through those because what the fall,
Okay.
generally those fall schedules are set like in the spring of the previous year. So what those looked like then look very different now, and they continue to change every day. So
Okay.
even if there is a schedule, schools and districts are changing daily what they're doing. A lot of it obviously for our capacity, and what I've said is I don't want to, if we're doing this, I don't want any of our programs, and part of our reopening plans is we would not be traveling or sending our students into areas that are quote unquote a hot spot for COVID right now. So that would not happen, so that could be even a last minute decision. If cases start spiking in a particular area, we would shut that down immediately. We're not going to do that. But obviously traveling to places is not an expensive feat. It costs quite a bit to transport our teams different places. And so in a shortened season and a reduced capacity, obviously then the revenue to do that is very different. So the schools are trying to balance that. So the schools are working on schedules because there are actual contracts that we have to sign with schools, and trying to potentially have schools get out break contracts or us break contracts with other schools. Some districts are being very cooperative with that, others not so much. So we are trying to just, again, get things in place, but we can always make last minute decisions if we need to make changes. That we've just got to be very flexible with that this year.
Okay. Thank you, Mayor Pro Tem.
Thank you, Commissioner. Are there any other commissioners who'd like to make comments? Because I don't see any. I don't have anything to add except that, I think that there's just too much sort of in limbo right now at the state level with the Department of Education. And so we have a great burden in our community to have to sort out with that sort of, what I'll be blunt, is a lack of leadership from the state. And so, we are all in this together. I will be visiting so that I can get a sense for myself what some of these safety precautions are going to look like, and so that also our community can see what these safety precautions are going to look like. Safety for our students, safety for our staff is the number one concern for everybody involved. And, of course, the city and the county are here for the school board and here for the superintendent in the event that you all need anything from us, but also to provide confidence so that we can have a unified approach in this community for how we're going to make it through the fall, so that everyone can make it. So thank you very much. Superintendent, if you have any final thoughts, now is the time.
Thank you, Mr. Chair. I appreciate the opportunity and appreciate the support. I feel it. It has been expressed. And so I certainly appreciate that, because this is a community event. This is a community scenario and a community situation. And it is so critical that we are all in this together, moving forward, supporting each other through this process. So, if there's anything that the school district can do for the city or the county, obviously that support level works both ways. So we're certainly partners in all of this moving forward, because the goal is to keep our community safe. And I recognize that the school district plays a big role in that. And so we are doing, everything we can feasible to try to make that happen for our students and staff, and appreciate both the city and the county's support, and the University of Florida and Santa Fe support in this as well, because they've been great partners for us through this process. So I appreciate the opportunity.
Thank you. All right, commissioners, we will give leave to the superintendent, and now we will move to the next section of our agenda.
Mayor Pro Tem, this is Larry Schooler. I'm sorry to interrupt, but we had thought that there might be public comment taken after each of the agencies, and so we've had a caller standing by for a bit. Let me know your pleasure in terms of when you'd like to hear from the public.
Thank you, Larry, and certainly I'm very, very appreciative for members of the public who have been waiting very patiently. This is an extensive agenda. And we have only gotten through our first two presentations. I would very much like for commissioners to have the opportunity to ask questions for our presenters, so that in the event that we are going to make motions and make policy, they can be informed, but then also members of the public can comment on any direction we may or may not give. I would like to hold off on that until that point comes. I believe there will be direction given. And then, of course, at the end of our discussions, we will be able to take public comments. So my apologies to those who have been very patient, but this is the first time that we have had University of Florida admins, the superintendent, city and county commissioners together, and I'd like for us to be able to provide order in that regard. So thank you very much for asking that question, Mr. Schooler. Our next agenda item is going to be the health department update from Paul Myers. Mr. Myers, are you with us?
Yes, sir. Good afternoon, Mr. Chair, commissioners. I'd like to share my screen if I could. Is that possible?
Yes.
All right, can you all see that?
Yes, looks good.
Perfect. Okay. Before I get started, just wanted to thank the superintendent because, you know, she has thanked the health department. She's thanked UF. She's thanked the medical advisory committee. And I want you all to know that she has most graciously offered space over at Fernside for a number of our staff who we have been onboarding and scaling up. And that's been going on for several months. So to echo a lot of the thoughts here, we are all in this together. And I just wanted to say that, you know, that goes beyond words. She has put in a lot of time and resources out at Fernside to house our contact tracers, our call center. And so, again, I just wanted to publicly acknowledge that. What you're going to see, many of you have seen in the past, and this really echoes what Dr. Luzardo had indicated in terms of the disease status in the community. There is cause for optimism, it's guarded optimism, but we are over at least the summer a surge, and I think you'll see that in the following slides. And to Commissioner Simmons' point, if y'all have any questions during the presentation, please just let me know and I'll try and answer them. So here's where we are as of yesterday, and we did add another 30 cases today. So as of right now, we are at 5,053 confirmed cases in Alachua County. We've tested almost 81,000 people in this county, which is truly remarkable. Our cumulative positivity rate, which I continue to provide because I think it adds some context, as of today is down to 6.20%. So that has remained relatively steady over the last several weeks. We have conducted over 132,000 tests. So obviously there are a number of people in our community who are being tested multiple times. So 272 residents, Alachua County residents have been hospitalized, and we hold steady at 31 deaths. 14 of those deaths are attributed to long-term care facilities here in Alachua County, unfortunately. The last 2 weeks, I know there's a lot of interest in the current status of the disease. We have processed over 16,000 tests, almost 800 positive cases over the last 2 weeks. Our positivity rate clearly is below what it has been over the course of this event. We're down below 5%. And over the last 2 weeks, unfortunately, we have had 83 residents hospitalized. But I think that what Dr. Luzardo and the team at UF Health and North Florida Regional Medical Center will tell you is that we are discharging patients much quicker than we were previously. So again, the skill of our practitioners in this community continues to amaze me in terms of how they have responded to treating our residents. And clearly, we're a regional hospital system. They have gotten a lot better in terms of addressing this novel virus. Here we have some of the metrics put into context with Alachua County on the left and the state of Florida on the right. Our positivity year to date, as I stated, 6.2%, less than half of what the state is. And so again, that's that balance between the mitigation and the suppression that some of the policy that have been put into place. I think that we're seeing that. And also, you know, balancing what our activities are out in the community. So a lot of that has to do with the policies that you all have put into place, but also how our residents have reacted and really conformed to some of the safety messaging that we put out there. Our hospitalization rate is less than the state. Percentage of cases resulting in death. This, again, probably twofold reasons for this. Number one, we have a much younger population in Alachua County. However, we also, you know, we do a great job with protecting the elderly. And I think that is evident in what it is that these metrics indicate. Population mortality rate, again, very impressive when it comes to comparison to the state, about a quarter of what the state is in terms of a population mortality rate per 100,000 residents. Again, our median age is less than what the state is. Pediatric, I wanted to add this metric in here, particularly given the impending opening of schools. Our positivity rate is about half of that of the state. So if anybody can pull this off, Alachua County certainly is positioned to do that. And that's not because we haven't tested our less than 18-year-olds in Alachua County. We've tested over 4,700 of them. We have had 5 hospitalizations and so far no deaths in this population. Long-term care facilities, as you all know, and I've been beating this drum since the very beginning, we do know who's vulnerable of this disease, relatively speaking. And our percentage of total cases from our long-term care facilities is less than the state. Percentage of total deaths from long-term care facilities, it's about equal to the state. But we also have about less than half of a percentage of long-term care cases resulting in death. And that's because very early on, before it became any sort of emergency order or executive order, we were in our long-term care facilities. We were testing staff, we were testing residents, and we were taking appropriate disease control measures such as the exclusion of positive staff. And so that's gone a long way in protecting those most vulnerable in our community. And the percentage of long-term care that have died from COVID-19, about a quarter, again, of what the state rate is. And so again, I think that demonstrates very early on what it was that we did here in Alachua County in terms of protecting those most vulnerable, and we continue to do that. Here you see what opening up does. This is not any surprise to any of us who have been following this. When you start to open up activities out in the community, we know how this is spread, large droplets, small droplets, aerosolization, that close contact. And so when we start to open up things in the community, we start to have more cases, but I think that we need to keep our eye on the ball. And that is, why did we put into place the mitigation measures? And we've heard about flattening the curve. I would like to propose that what we have done and focus on in Alachua County is flattening the curves. And those curves are number of cases, number of hospitalizations, number of admissions into our ICUs, and deaths. And so we have been successful in flattening those 4 curves. Now, what you all have done in terms of policies, you have balanced the science, and that is how do we flatten these curves with our values, and that is jobs, education, other activities out in the community. And so that's where this balancing act comes in terms of science versus policy. When do we step on the gas? When do we start pumping the brakes? And I think that what we have done in Alachua County and what these data show is that we have been relatively successful when it comes to flattening these curves and balancing that with the policies that you all have put into place. Here's positive cases compared to total lab results. This is just another way of showing the tremendous amount of testing that we have done in Alachua County and the percent positive. And so we are trending positively. Again, we have some guarded optimism here as we do head into the fall. Daily case increase since the phase 2 reopening. Again, we are trending positively here as well. Several weeks ago, about a month ago, we were getting triple digits, and now we're down into consistently under 50 cases per day. The same type of data, just showing with a 5-day rolling average, and you can see how we're trending positively. Here we are in blue. The state of Florida is in orange, and we have always, since the beginning of this event, trended more positively than the state. A lot of that has to do with the University of Florida and the school shutting down relatively early. A lot of it has to do with our residents practicing that social distancing, those mitigation measures that very early on that we were putting out there. And so again, Alachua County is faring much better than the state since the beginning of this pandemic. 30-day hospital trend. Again, this is why we flattened the curve. We had to protect our healthcare system, and we have done that in Alachua County. Again, we have great management in North Florida, the VA, and UF Health. And so that gray line at the top, that's COVID hospitalized. As Dr. Lizardo had mentioned earlier, and this is North Florida and UF Health combined. About a month ago, we were looking at over 140 patients hospitalized primarily for COVID. The COVID in the ICU is in orange and the COVID on vents is in blue. And so over the last month, we have trended positively. As of this morning, we had 109 people hospitalized in Alachua County. And so that is a tremendous decrease over where we were a month ago at this time. Again, good news, and I think that we need to celebrate the good news when we have it. Here's some metrics that I have shared with the Board of County Commissioners in the past, and now I'm sharing it with the city. Clearly, the city of Gainesville has more cases just because it has a bigger denominator, it has more population than our surrounding small municipalities. And here's the cases per capita where we try and smooth this out. Clearly, Archer and Hawthorne, with very small populations, any kind of fluctuation in their positive cases tends to increase those numbers. But Gainesville is doing relatively well when it comes to cities like Alachua, Newberry, and High Springs when it comes to comparing them in cases per capita. Cases by age, it's no surprise, just these raw numbers. We have the largest percentage of 15 to 24-year-olds as a percentage of our population in the state of Florida. And so clearly we have more cases. But this is just a breakdown for y'all to take a look at in terms of how many cases we have in these various age groups. COVID-19 Alachua County hospitalizations by age. Again, this is reflective of those who are most vulnerable. We have had one case in an individual less than 4. We've only had 4 cases in the 5 to 14-year-olds, 8 cases in the 15 to 24. And then, of course, you can see where it goes from there. We haven't had anybody pass away in Alachua County under the age of 50. And here are the deaths that reflect that. It's not a surprise that this is a deadly disease, to Commissioner Ariola's comment earlier, but it's a deadly disease for those predominantly over the age of 65. The vast majority of individuals who contract this who are less than the age of 65 are going to do okay. That's not to minimize the severity of this disease, but we do know who's vulnerable, and that has not changed since the beginning of this event. Pivoting a little bit towards test results, consistently over the last month or so, we have been getting our test results back in 24 to 48 hours. That's both from the Bureau of Public Health Labs in Jacksonville and also LabCorp, our 2 main partners here at the health department. And so that really helps us with our contact tracing to get those lab results back in a timely fashion. And we have been doing that. We did have a national issue about a month ago. That supply chain looks like, at least in Alachua County, we have figured that out. So again, good news for us here in terms of our contact tracing and our disease intervention measures. So in terms of contact tracing, we are successful in attempting contact with the staffing up that we have done with the funding from the county, funding from the state, and we were one of 3 counties that we were able to advocate for getting a CDC forward team, and we did get a team of 6 individuals who we now have housed here in Alachua County who are helping us. They're going to be dedicated when schools open to helping us with that contact tracing. I referenced that a little bit earlier. So we were fortunate to have them. And so with the scaling up and the 28 individuals we have embedded at the University of Florida, and those who we have brought on here at the Alachua County Health Department that are housed at Fernside, we were able to attempt contact to 100% of the positive lab results within 24 hours of receiving results. And to Dr. Lizardo's point earlier, we are able to successfully interview those individuals within 48 hours, 83%. That is really a remarkable feat and does a lot towards slowing the spread in Alachua. I include these slides only because it is a good news story, and I think that we all need a little bit of good news these days. In terms of the gating criteria, we are meeting all of these. As you all know, it's based upon symptoms and cases in hospitals. In the status of all 3 of those, we are doing very well over the last 2 weeks. I include this again just because we have had positive trends over the last 2 weeks and really over the last 30 days, if you have seen with the data here in Alachua County going into the fall. I won't spend a lot of time on this data because I know that you have seen this in the past, and this is just the data that supports the qualitative references that I just made on the previous slide. So we're meeting all this criteria as of right now. The cases, we're meeting the criteria, downward trajectory of documented cases within a 14-day period. You saw that in the previous slides with the epi curve, and clearly the positivity rates are going down. Positivity percentage for the previous 14 days, again, going down significantly. Our hospital system, again, just another way of showing the data. We have never in Alachua County approached crisis care where medical decisions are being made on a lack of resources. That's just not the case here, and I don't anticipate that that's going to occur. ICU trends, you've seen this in the past. Pre-COVID, we were operating 80 to 90%. We'll continue to operate that way today. And again, one of our focuses here at the Alachua County Health Department very early on, and this was in collaboration with Dr. Morris and Dr. Lizardo. Where do we focus our efforts? Very early on, we focused them on long-term care facilities, and you saw that with the death rate, you saw that with the cases, and so we're going to continue to do that here in Alachua County. I put this in here because there's a lot of interest in the antibody test when you donate blood now at Life South and in other places. They do test for antibodies. Again, this should not be used for clinical management. It shouldn't be used for anything other than research and epi-surveillance. When you take a look at the 4.65 positivity rate, that translates into about, what, 13,000 people if you take 269,000 people in Alachua County, and we've only identified 5,000. So again, we've identified, what, about a third or a little bit less than a third of the cases here in the county. So again, interesting research purposes, not something that we're going to hang our hat on, but I think it does provide just another tool and some additional context for how this disease is spreading in Alachua County, in the state, and across the country. I've seen studies where this is consistent between 3 and 6% of these studies across the country are positive for COVID-19. I had this in here because we presented to the school nurses a week ago, and this is to demonstrate the difficulty that we're going to have when schools open up. If you take a look at symptoms of COVID-19 on the far left and then flu, which is the fourth column, the only difference between the two really is the shortness of breath. Flu is the only one that doesn't have that. With COVID-19, you have shortness of breath. And so as students present to the school health clinics, and having had a family member who was a teacher for over 10 years in Alachua County Public Schools, every fall, my wife would come home and she would bring home the grunge. And so that's when flu starts to circulate. And so we can expect to have a number of individuals who are presenting to our nurses who are on the front line of this in Alachua County schools. And we're fortunate to have a school in every single, we're fortunate to have a nurse in every single school in Alachua County. I spoke to them this morning, not just about flu, but about COVID. And they're on the front lines. And I'll tell you what, this is going to be everybody who presents, everyone's going to be thinking COVID when it could be any one of these things. We're into allergy season now, so it's going to be difficult to differentiate. And that's why we have the metrics in place to rapidly go in and respond to potential cases, and we're going to test, and we have the metrics in place that the school board can consider for when what we do when we have a case, because we're going to have cases. But again, I want to remind everybody that in this age group, schools have opened up here in Alachua County in private and charter schools. We have one private school with over 500 kids in it, over 80 staff. And while we have had some cases there, we have had absolutely no hospitalizations. We haven't had any transmission between the students. And so if the last 2 weeks is any indication, then I think that we have some optimism, again, guarded optimism going into the fall. But we are going to have cases. But again, we have to remember that in this population, they're going to fare very well, relatively speaking, as opposed to older adults. This is CDC guidance that I put in here because I know this presentation gets circulated. And so again, these are messages that we put out, public health messages: watch your distance. This disease is all about distance, and we clearly have other tools: wash your hands, wear a mask. In Alachua County, we have a mandatory mask ordinance. You just heard the superintendent talk about mandatory masks there. The University of Florida is instituting mandatory masks. And so, we have these measures in place in Alachua County. The health department isn't the only game in town when it comes to testing. I shared this with the county commission 2 weeks ago. Clearly, we still have testing available through the county health department, but there are other locations as well where testing is available. You heard Dr. Lizardo talk about how testing is but one tool in the toolbox, and if we could test everybody every 2 weeks, that'd be great. But we don't have the capacity to do that, and so there are other areas in town where individuals who want to get tested can get tested. And again, just want to point out that these are the 6 individuals who are part of our scientific medical advisory committee. Dr. Morris and Dr. Lizardo, I leaned on very heavily at the beginning of this. You heard that we've had a relationship going back decades. And that's true. You know, Dr. Lizardo is our tuberculosis physician here at the health department. He has been instrumental in guiding us through a lot of this. Dr. Morris is the director of the Emerging Pathogens Institute over at the University of Florida. So those 2 individuals I was talking to about this in January. Dr. Kathleen Ryan, she is the medical director of our control flu program in Alachua County. And so when it came to anything pediatric, I was leaning on Dr. Ryan very heavily. Dr. Yana Banks was a pediatrician here at the health department for years and years and years, saw many of our community children grow up here at the Alachua County Health Department. Then you have Doctors Nelson and McCune, who we brought on board when it was clear that we needed some additional expertise and some additional perspective when it came to developing metrics for the opening of schools. So again, just wanted to publicly acknowledge them for their tireless efforts in these really unprecedented times. And with that, Mr. Chair, I'll turn it back over to you for any questions that I might be able to answer.
Thank you, Mr. Myers. I appreciate that detailed presentation. I do not see any hands from any commissioners. Perhaps they need a moment to come back to the screen. But if any commissioners would like to ask any questions of Mr. Myers, now would be the time. It seems we are wearing ourselves out, Mr. Myers. I don't have any commissioners willing to speak, or rather they've had their questions answered by your presentation. And so I would like to thank you. We will keep this thing moving along. We appreciate the work that the health department has been doing. And of course, every time that you've come before this board, you've brought plenty of data in preparation and have shared with us. And I do believe that our local government coordination with your office and with many other governmental offices have helped to keep the virus mostly in check here in Alachua County. But as we were seen by the data shown, premature reopenings don't work. And so we're very grateful that we have had coordination here to keep our course steady. Thank you very much. We will give you leave unless you'd like to stick around, of course. And we will now move on to a CARES Act funding update. I believe this is going to be the county manager, unless I'm mistaken.
Mr. Chair, we have, and I think they've let her in if she is on. We have April Shuping with Cars Rig Ingram on the Zoom with us. There she is.
Ms. Shuping, how wonderful to see you again.
Nice to see you again too. April Shuping, partner with Car Rigs and Ingram. We are working closely with county staff to help them administer their CARES Act funding. The program has really been split into 3 main categories: governmental, to assist all the municipalities, constitutional officers, library district, and children's trust, and the health department as an important partner in that, individual assistance and business assistance. We opened the individual assistance portal very quickly, about 3 weeks after the funding agreement was received. We have gotten over 4,000 individual applications already. We all opened the business portal a week later and have about 236 applications from businesses split into small and medium businesses. Of those, we've been really carefully, we've been making sure we understand the jurisdictions that each of those applications is coming from and tracking that to see if any outreach is needed in some of the maybe digital divide kind of areas in Alachua County. And what we found is that they're really closely tracking population, as you would expect, but we were a little worried about that. And so right now on the individual applications, 52.8% are coming from within Gainesville city limits and 34% are in the unincorporated. The rest follow the other municipalities very closely, again, with their population, with Alachua and Newberry and High Springs making up the bulk of those. Business applications are similar, although there is a slightly bigger, slightly heavier weight towards Gainesville, as you might imagine. We have almost 66% of business applications coming from inside Gainesville corporate limits, with about 20% in the unincorporated area. After that, you have a very similar population driven allocation. We're getting ready to make our third distribution. As you can imagine, there's a whole lot to look at in these applications to make sure that we're in compliance with the federal guidelines for CARES Act. And we have taken the approach, we're also helping run a help desk line with chat, email, and phone features. As you can imagine, we are trying to help a very wide variety of people. We have Spanish speakers and people who maybe aren't as digitally savvy for our online application. We have paper applications available, but our staff is also helping people walk through, maybe get a little creative and helping them figure out, I only take cash, how can I show an income loss? So we've had over 8,000 contacts with citizens over the last 3 weeks to help them with questions about applying, questions about eligibility, documentation requests. And we are, with this last distribution that we've exported to go out, we're getting ready to hit our first $1 million distributed mark with our expectation that that'll be another million the following week. And the pace is kind of picking up. It's doubling or tripling every distribution we get out as we start working through some of the challenges of the process. So we're really excited to be able to help our citizens and our own community and to be part of this. As some of you know, I've been out of local government for about 3 years now, and it's been really nice to get my feet wet again. So I'm happy to answer any questions. We have on the government side sent out draft interlocal subrecipient agreements to every government with their allocations in them. We are working, as once that happens, it jumps into attorney land. So we are working through the different city and county attorneys to get those finalized. We are ready to start funding any government requests as soon as those subrecipient agreements are gotten back in and approved by the commission. So any questions or concerns?
Thank you. I don't see any blue hands from the board. And so I will go ahead and ask one more time if commissioners have any questions for Ms. Shuping. Now is the moment. Okay, very well. Well, we appreciate, of course, your involvement. I know that the county has been very communicative with us for their draft plans, and certainly administration and disbursement was a huge concern, just to make sure that it gets done well. And so very confident to have someone local doing that. So it brings rest to me. So seeing no comments, we will give you leave. Thank you very much for being here with us today.
Thank you.
Commissioners, we will now move to our last update, emergency management update from Mr. Hal Grebe, who has been most patient waiting for us. And certainly, let me just say, from the outset in March, the emergency management division has been at the center and the focal point of our response. And sir, you have my appreciation and gratitude because it was a very, very scary time in March. And since then, we've been steady course. So thank you very much. Please, the floor is yours.
It's sincerely my pleasure. And just again, thank you for the invitation and the opportunity to bring everyone up to date on emergency management operations in 2020, focusing on COVID-19 and hurricane preparations. And I realize I may not be in the public spotlight as much as others in my profession may be. However, I've always kind of held my personal philosophy that an unknown EM is a successful EM. So please don't confuse my lack of spotlight with a lack of effort to support our local leaders like everybody on this call. I have been meeting and communicating weekly with leadership at all levels, to include every agency that's been on this call. And while the function of EM may statutorily rest at the county level, I always like to remind everybody, including our citizens, that the responsibility of emergency preparedness always lies within each organization, agency, and the individual. And this is what we refer to as the whole of community preparedness. And basically, while the essence of Florida State Statute 252 is that the county emergency manager is charged with stewarding local government's interface, it's really in relation to the community's resilience on how we can better respond to impacts from an emergency. So I always like to remind everybody that our resilience is dependent and determined by one's internalization and ownership of their role in emergency preparedness. And that may look different from person to person and even agency to agency. And so it's to this point, I'm really proud to highlight what we've been able to accomplish as a community through the Alachua County Emergency Operations Center's team. And just so everyone's aware, that team in our EOC is not county specific. It's composed and comprised by a cross section of county, city, higher education, hospitals, and other area stakeholders. So to date, in coordination with our local partners, in supporting COVID, we've been activated for 23 weeks and 3 days. And if you're counting, that's a total activation of 163 days virtually. I did the math. Fun fact, I've been activated since coming on board to the county. 38% of my time has been dedicated to an emergency activation for the county. So in that activation for COVID specifically, we've had a total of 783 resource requests to our EOC. 575 of those have been completed or partially filled, and 196 of those were found to not meet the emergency need or vetting criteria. So what have we delivered to date? We've delivered out to our community 334,000 surgical masks, a total of 170,000 N95, 128,000 gloves, 42,000 isolation gowns, 14,000 face shields. And again, that goes to all of our different community stakeholders throughout the county. And we've coordinated temporary staffing to support healthcare facilities in conjunction with DOH and state staffing. And please note that all of these distributions were accomplished in a decentralized operations, as we at the county don't have a centralized warehouse, staging area, or emergency county staging area warehouse staff. So in relation to community direct community support, we have helped facilitate the delivery of 107 pallets of food to all the county municipalities and nonprofit agencies. We've delivered 190,000 cloth reusable masks to our municipality and agencies to be distributed out to our general community residents. We've had direct deliveries of food to our vulnerable populations, which included an initial push to approximately 800 households at the beginning of the incident. We've facilitated non-congregate sheltering for FEMA so that any FEMA public assistance agency within our jurisdiction, or our county boundaries, has the ability to support non-congregate sheltering for those vulnerable populations. We have supported to date, just at the county side, 10 non-congregate shelterees to this point. That does not include University of Florida, the city, or Shands' use of that system. We've supported homeless and vulnerable populations through our 311 operators, community portal submissions, our mass care, and our food and water program staff. And we've been currently working to connect those in need economically or with food disparities to existing programs and long-term food and fiscal support. We've outfitted our homeless outreach teams with PPE, reusable masks to give out to our homeless population, and food boxes to support them where they're at. We've also conducted virtual preparedness seminars to both businesses in our community and faith-based organizations at their request. So hurricane shelter preparations, that's kind of the hottest topic as we're reaching peak hurricane season in September, and mid-September is our peak. So since April 13th, we've formally documented and reported to our stakeholders all the EOT's work to enhance hurricane emergency operation plans in relation to COVID-19 impacts. So we've set aside a cache of PPE for all of our potential shelter staff and anyone seeking shelter. That includes gloves, gowns, face coverings, face shields, hand sanitizer, and cleaning solutions. On June 3rd, we conducted our virtual hurricane season kickoff for all of our EOC stakeholders, of which the city of Gainesville was a participant of. Staff has completed a walkthrough of all of our 20 facilities that could be activated as a shelter. We've done that walkthrough with a reevaluation and an approximation of how we could redistribute our emergency shelter capacities. And so the numbers I'll read off again are approximate. We have to gauge, our shelter managers are going to be charged with gauging family units and individuals and how that space allocation looks like. But generally speaking, our congregate capacity at 60 square foot per person look to be about 2,700 to 3,000 people. We have a COVID positive shelter capacity, and that would be at 20 square foot per person at about 457. With our current non-congregate shelter capacity, we have 5 hotels at approximately 176 rooms that we have kind of not on standby, but under contract. And if we need to activate an enhanced non-congregate shelter in coordination with the state, they have 536 rooms in our area. That would give us about 712 potential rooms available for non-congregate shelters if those are available. Our special needs for non-COVID are up to 294 if we had to activate all facilities. And our total special needs capacity with COVID in a non-congregate shelter would be about 20. So again, these are all planning numbers, and none of this survives the first point of contact in any planning effort. So on August 6th, we brought together our entire EOC team, again, comprised of everybody as a cross-section of the community. And we conducted a virtual tabletop exercise on our plans during COVID. And that, again, that included numerous City of Gainesville staff, to include RTS, GRU, and the emergency manager, District Chief David McIntyre. So some of the biggest needs from that virtual tabletop that we identified was, again, just a limited number of shelter spaces because of that increased square footage recommendation by the state and CDC. We're going to have a potential for people seeking shelter that may not need to seek shelter. So again, the message is to really help people know your home, know the capabilities, and know your zone. So in Alachua County, we're not in an evacuation zone. Those are only coastal community or areas that have potential for surge. But we do have communities that are in flood-prone areas or substandard manufactured homes. So educating or understanding where you live and what you can do would really help offset that demand. And we always recommend trying to stay with family and friends before you seek the public emergency shelters. So with that exercise, with those gaps, we're working, or we have developed our operational draft of our COVID shelter strategy. And we continue to provide updates to our MAC group, which includes all the constitutional offices, DOH, and the City of Gainesville manager as incident specified representatives. And we continue to meet weekly with our emergency operation teams and give updates on COVID. And anytime that there's a tropical weather that is forecast to show potential for local impacts, we'll include that in our updates. It's really a balance of making sure I'm hyper-focused on what the National Weather Service is saying as far as our local impacts. And again, there's a multitude of information sources out there. And so I have to kind of distill down the noise and focus on those subject matter experts that are charged with doing this for their daily job. And that's primarily the National Weather Service Jacksonville, and of course the National Hurricane Center. So in relation to special needs, I know there's been a lot of questions that y'all faced in these public meetings. So I want to say one of the things that we've done at the forefront, even prior to hurricane season, was I really evaluated coming on board on how easy it was for our special needs community to apply for the special needs registry. So since my time coming on board, we've created a better, faster, and more streamlined online and mobile friendly process that anybody can go to and register as long as they're within that vetted special need. It's acbo.cc/special needs. Again, that's acbo.cc/special needs, all one word. For special needs sheltering, it's imperative that those who believe that they need to seek special needs shelter apply ahead of time. Now is the time to do that application, because the special needs shelter is primarily for individuals with a vetted special need, and they're vetted by the Department of Health. It means that you don't have any local family assistance for transportation and sheltering in a disaster such as a tropical storm or a hurricane. You do not have any other options but to request public transportation or that shelter. You live alone or with another person with special needs, or you reside in unsafe housing during a storm, such as a mobile or manufactured home, and you cannot drive to any of those you cannot drive or access any transportation to that. So people who are not eligible are people requiring hospital care to treat severe or advanced medical conditions. They are not eligible, and they should make prior arrangements with their doctors or hospitals for transportation evacuations. Additionally, people not eligible for special needs sheltering are residents of assisted living facilities such as nursing homes, group homes, or retirement facilities. These agencies have a statutory obligation for their own emergency plans. Should they not be able to perform any of those services locally, they would have to provide transportation and shelter elsewhere. So we continue to evaluate emergency shelter retrofits. We're currently not in a deficit of shelter spaces, but that doesn't mean we're not going to stop trying to meet the need where it exists for those vulnerable populations. And we're currently working on some of those things, looking at how we can better shelter homeless populations or those that may be vulnerable. Again, we've got some meetings set up with the city on some of those ideas. But with that, that's kind of my quick overview, and wanted to just thank you for the opportunity to share all the great work that so many across this county have been doing.
Thank you. Very appreciative of you being here with us and waiting to the end. I don't see any hands again from commissioners, so I will assume that means that they have been satisfied with the presentations. So thank you very much. We will give you leave so that you can return to your work.
Thank you.
Commissioners, we are nearing about 3.5 hours on the meeting, which actually I will say is a very quick city-county joint meeting. If there's any deliberations for motions that would like to be made, I'd like for that to be done now before we move to members of the public. So Commissioner Ken Cornell, you are first.
Thank you, Mr. Chair. So Hutch, what kind of direction do you need? We want to move the emergency order to limit indoor activities to 10 or less and outdoor to 50 or less?
Yeah, we'll work on drafting that, make it effective, try to pass it around to municipalities and so forth later this week, make it effective on Monday. The other thing to know is that there's theoretically this meeting between attorneys and operational police staff, and it may be that they come up with some language changes for the emergency order that give them some of the power and directions that they need.
Yeah, so city commissioners, we passed yesterday a motion to basically direct our staff to coordinate with GPD and UPD and ASO to allow for enforcement of the order in a consistent way. So I don't think I need to add that to this motion today. Do you think, Hutch?
Nope.
No, okay. So I would just move that we empower the chair and staff to adjust the emergency order to limit indoor activities of 10 or less and outdoor of 50 or less.
Second.
Thanks, Mike.
Mr. Hutchinson, that is your board's motion. I don't see any hands from the city commissioners, and without objection, we will take that as, oh, nope, one just popped up. Commissioner Adrian Hay Santos.
Thank you, Mayor Pro Tem. Just a question for the county. Your order is not for like restaurants or things like that. It's just for kind of private homes or private events. Is that correct? Or does it include restaurants as well, not having 10 or more? Or
well, the restaurant part of it is, well, first of all, we haven't gotten an indication that restaurants are a problem. I've asked that question several times of Paul Myers, and the within restaurants, as long as they have placed the tables the way they're supposed to, I would consider a table with more than 10 people to be violating it. But if there's 6 people sitting at a table, okay, and 6 people sitting at that table over there, I'd say they're fine.
Okay, but it's mainly focused towards like private
right
events and stuff like that. Okay, all right, thank you, Mayor Pro Tem and Chair.
Yeah, I mean, I think it's gatherings of more than 10 where social distancing can occur. I mean, that's really what's in the order for, right?
Mm-hmm.
That was going to be my clarification, that it's for where you cannot have social distancing, because if you can, then obviously more than 10.
And just keep in mind that our order has no jurisdiction on the university, Santa Fe, or the school board. So they can take it under advisement. They can say they want to be in lockstep, but in reality, unless they adopt it themselves, our order has no authority on them.
So how'd you bring that up? I mean, I brought this point up when we were talking with the UF. I actually think, and maybe we should do a chair letter. I actually think asking the university to enforce through student conduct code violations of gathering or parties is a lot more effective than them getting a ticket. Do you kind of agree with that?
Yeah, and the discussion we've had is that you know, if you show up at a party, if police officers show up at a party and they say, here's a civil citation for $150, the party goers say, great, we pass the hat, we take care of that and keep partying. If a university official shows up and says, all right, everybody here who's a University of Florida student is going to be under academic suspension.
Right. That's the only
whatever the sanctions are, that has a lot more effect than a $150 fine spread between 10 people.
So you've had the discussions directly with them. Do you, would it be helpful to have a chair letter to that effect, or is that something
Yeah,
that?
I think it would, because we know that some universities, Michigan most notably, is sending university officials out with the local police or codes enforcement people to wherever there's student conduct issues off campus. And the University of Florida so far has said, interesting, you know, they're sort of looking around who's going to volunteer to go out at 11 o'clock at night and bust up parties. But I think that would certainly, Gainesville police officials would probably appreciate having that university person with them to reinforce the message.
Okay, so if Mike approves, with part 2 of the motion would be that we do a chair letter and encourage the city to do a mayor letter to encourage and support the university for adding some sort of a student code of conduct violations for, you know, for violating the emergency order or violating gatherings, groups of gatherings.
Right.
Is that okay, Mike?
Yeah, that's fine.
Okay, thank you.
Excellent. Thank you. Mr. Chair, what I will do is I will conduct public comment, and then I will, at the conclusion of public comment, I'll turn it over to you to conduct the vote, and then I will resume chairing the meeting. Mr. Schooler, are you there?
Yes, sir.
Very well. The time has come for public comment. We have a motion on the floor for the Alachua County Commission to amend their emergency order. I will be completely flexible in public comment and allow for members of the public to comment on anything that they have heard in this meeting, because we did have many presenters, and for the good of the order, we did push public comment until the very end during legislative periods. So we will take our first caller, please.
Thank you, sir. And should we enforce a 2-minute limit or a 3-minute limit?
2 minutes was decided at the very beginning.
Okay. Our first speaker is Debbie Martinez. Ms. Martinez? And you'll have to mute your
yes,
sound
thank you
there.
so much. Can you hear me okay?
Yes, we can hear you fine.
Hello?
All right.
Okay. My name's Debbie Martinez, and I'm a retired registered nurse and a substance abuse counselor. And I want to praise the City Commission and the County Commission for how well you have handled this pandemic, you know, the coronavirus pandemic thus far. One careless mistake, and that could change everything. Next Thursday, the City Commission will be voting to approve a citywide alcohol open container ordinance. And this activity, you know, especially appeals to college students and high school students. We all know the dangers that occur when you mix young students with alcohol. I do not believe parents expected this when they decided to send their children here to college. I believe that you would be making a grave mistake by allowing young people to consume alcoholic beverages, open containers, downtown or midtown, on county, city, or state property. This is the camel's nose under the tent. Common sense tells you this is wrong. At this time, large gatherings and parties should be discouraged, regardless of where they are held. Far too often, young people fail to adhere to physical distancing and wearing their face masks, especially while attending outdoor alcohol events. So please vote no on this motion. And as far as the recommendation, I support the recommendation that the chair send UF a letter, regarding the student code of conduct recommendations. Thank you for your consideration.
Thank you for your patience.
And Mayor Pro Tem, next speaker is Nathan Scott, who will also have 2 minutes. Nathan.
Yes, thank you, Larry. Good afternoon, Commissioners. Nathan Scott. So I've listened to the lengthy discussion. I think it's been a couple hours now. I think it's well intended, but I do have some concerns. First and foremost, I wish that the Gainesville City Commission and Mayor, contrary to their assertions that they have meetings about GPD, which is clearly about defunding the police department, not enhancing public safety. I wish equal time was spent on addressing the numerous shootings and bullets flying all over the city of Gainesville. That doesn't seem to take precedent over the virtue signaling we hear. Secondly, with respect to the proposed motion, again, I have concerns. This is morphing into a draconian police state. I think that you can encourage students with the carrot approach rather than the stick. You guys are talking about academic suspension and all these draconian situations, which just, students are intelligent. They can make smart individual decisions. And I just think that this totalitarian approach that's favored by numerous city commissioners who want to perpetuate this pandemic crisis, notwithstanding the data presented by Paul Meyer shows that we were making great strides and the death rate is very low. You guys want to perpetuate this crisis and continue to control every aspect of every person's life. But more importantly, you seem intent on continuing to further destroy the local economy. When we hear about shutting this down and shutting that down, how do you expect local businesses to survive that depend upon the students, and particularly the fall football season, to even make ends meet? I mean, you're crippling the local economy as opposed to encouraging people to do the right thing rather than trying to control every aspect of life. And as Commissioner Hutchinson noted, you don't have jurisdiction over UF or Santa Fe. And thankfully, the state does have preemption on certain things. Otherwise, you control and try and command that also. Thank you.
Mayor Pro Tem, that's 2 minutes. Thank you very much. Mayor Pro Tem, we don't have any other callers on the line at this time.
Very well. Thank you to our 2 callers, again, for their patience in this more lengthy meeting than usual. Okay, Commissioners, I will now turn it over to the chair to conduct the County Commission's vote.
Any other comments about the motion from the commissioners? If not, all in favor signify with aye.
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 That motion passes 4-0. Commissioner Wheeler, not in the room. Thank you very much.
Thank you, Mr. Chair. We have reached the conclusion of our business. Therefore, I would just like to offer the opportunity for any clarifying questions, comments, or concerns from either staff or commissioners. Going once, going twice. Commissioner Byerly.
Sorry, I didn't get the little blue hand up in time.
Apologies.
Were we going to discuss the issue of picnic tables outside, Hutch? I thought you were going to bring that up.
Yeah, I think that's a good idea. So the city's talked about opening up lot 10, maybe lot 13 and some other potential venues, and the county has been asked to make the west lawn of the county admin building on South Main Street available. Our plan would be to put picnic tables out there, picnic tables that we were planning on purchasing anyway for parks. But we were curious about how the city was going to be managing or not managing your venues, because we do have some concerns about the messaging that we're sending about gatherings and that sort of thing. I'll say right up front, I think it's a good idea. I think the more we can encourage people to—
You have been muted. To unmute yourself, press the star key twice.
Outside.
Hi, caller beginning in 352371. Can you hear me okay?
Mute, Mr. Schooler, thank you.
Yeah, the more we can encourage people to pursue their recreation outside, the better. It's a good location, but I'd be curious to hear from either the city manager or other city officials on how you'll be managing your sites to see if we need to do something similar.
So, Chair, Mayor Pro Tem, with your permission, I'll just comment on that. So, we're going to enforce the county's order. If that's 50 gathering, no more, then we will be out there making sure that that crowds are limited to sizes of 50 in a socially distant fashion. So there won't be seating at tables of more than 10. Tables will be spaced out. We will make sure that there are crowds that are not, gathering larger. We'll be doing that with the same way we've been enforcing downtown and midtown businesses with our patrols, which are code enforcement, fire inspectors, and then augmented with GPD as necessary.
Please, Commissioner Byerly, you still have the floor.
So, just before hearing, what if city commissioners have any thoughts, I want to kind of clarify a little bit what we had in mind. And we talked about this at some length in our county commission meeting yesterday, and all 5 commissioners sort of had a different take on what it means and how we would do it. But the thinking, I believe we all agree, is not to set up a venue to attract more people downtown and have more crowds. The idea was that people who are downtown and want to eat at a restaurant or get some to-go food or one of the street vendors or something like that and get their food would have a seating alternative rather than having to be inside a restaurant necessarily. They could take their food with them, sit outside in a safer, more open air environment, which might bring the effect of bringing some more people downtown in order to eat at a restaurant. But the idea that a few picnic tables scattered widely around the county administration buildings, West Lawn, is going to become party central, I think, is not really shouldn't be a serious concern. It's people who are down there, giving them a place to sit and maybe eat. There was some kind of peripheral concern about it becoming a place for the homeless community to hang out. I know that the city had problems with that in the downtown plaza with some of the tables that they had there, and I believe the city has removed those tables now completely. And I think the response to that is not so much that there were that we had the tables there, but that we didn't have enough tables. The solution to that is to have enough tables where enough people can be down there to where it doesn't become a problem. So that's what we're thinking. It was just an idea, an experiment to kind of, we're going to get the tables anyway. We could put them on the West Lawn at little expense for a while, see if it works out, see if people appreciate it. If it becomes a problem, we can readily transfer them onto the park facilities where we were going to put them anyway. And there was some questions in our meeting yesterday about whether or not the city is considering anything similar on any of its parcels other than the Lot 10 discussion, which is something that doesn't look like we're going to move forward with. That was it. Thanks.
Thank you, Commissioner Byerly. Commissioner Ken Cornell.
Thank you, Mr. Chair. So yeah, city commissioners, if you want to see 5 commissioners with different opinions on this, go watch yesterday's tape, because I think Mike kind of hit it. I think everyone kind of has their own idea of how this could be helpful. I'll just communicate what I said yesterday, which is I think the optics are bad. I think in a time when we're concerned about group gatherings, we're concerned about the return of students, the start of school, I think this is the wrong thing that we should be promoting. What I did say was that this county commissioner supported activities that cities did as long as they did them in a safe way. And so from my perspective, if you needed the lawn space for an activity that the city is monitoring and kind of coordinating and sponsoring, that's fine. But I didn't think it was a good idea for the county to utilize county chairs or county staff or county enforcement personnel to try to break up gatherings when we're trying to prevent gatherings. So I'm not in favor of this idea. And so I wouldn't support it at this time. Thank you, Mr. Chair.
Commissioner. And thank you for bringing this up, commissioners. This was something that I think the chair and I had intended to get to, but as usual, business always is much longer than anticipated. I think the city manager has a presentation that was distributed to commissioners that we will be going over next Thursday when we discuss the proposal to lift the open container ordinance, which I will say, not as chair, but as a commissioner, I do not support for much the same reasons you said, Commissioner Cornell. Messaging and optics is very, very important right now. And certainly, we don't want to be sending any mixed messages. So thank you all very much. Unless there is anything else for the good of the order, we will be adjourned on the city side. Mr. Chair, I leave it to you to adjourn the county. Thank you.